Welcome, everyone. I will now call the September 8th regular meeting of Council to order at 6 p.m. Are there any disclosures of pecuniary interest? Seeing none, Council Use, please, with the consent agenda adoption.
Yes, thank you, Mayor. Good evening, everybody. Moved by myself, Councillor Hughes, seconded by Councillor Helleroo, that the items contained in the September 8th, 2025 consent agenda be adopted as presented.
Discussion? All those in favor? Opposed? That is carried. Councillor Hughes for the August 11th minutes, please.
Thank you again. Moved by myself, Councillor Hughes, seconded by Councillor Van Kooten-Bossenz, that the minutes from the August 11th, 2025 regular meeting of Council be adopted as presented.
It's quite okay. We're all new here, right? Discussion? All those in favor? Opposed? That's carried. Okay, at this time, I will turn it over. We have our first delegation presentation prior to our special staff report. So I'll turn it over to our CEO, Mr. Grace, for introductions, please.
Sure, I'll introduce Mr. Barrett from Michael L. Barrett and Associates here, who's assisted us in developing this health strategy. Council will recall that some time ago we were being requested to fund certain healthcare services, and Council found it difficult to determine how much and what should be prioritized. Council set a goal in its strategic plan to look at a method of ensuring that we are doing the appropriate things for health services. That developed into a health strategy that was included in the budget, and Mike's here. He did a status report previously, and now he's here to present his health strategy.
Great. Red light. Okay.
Welcome.
Thank you, Mr. Mayor, and thank you, Council. It's nice to be back. As I said when I was here last time, it's been 30 years since I was in this council chamber before, and I was working with that council right there when I was a land use planner. So it's been a long time, but nice to be back, and really nice to do work for the town of Ingersoll. It's got a spot in my heart for having been here for many years when early in my career. So I appreciate the opportunity to have this, do the health study for the town of Ingersoll. I think it really shows the direction and vision for the town, saying that they want to have this health strategy put in place. As we've talked about when I was here last fall, upper tier municipalities know what they're doing typically with the healthcare system. So they have EMS, they have public health, they have long-term care, but lower tier municipalities, the 8 here in Oxford County, don't always typically know what their role and responsibility is with healthcare. So that's why Town Council and Michael, the CAO, asked me to come forward and prepare this health strategy to put it together. And I think everyone hopefully would agree that the local healthcare system is a vital part of a vibrant and successful community. And I'll talk a bit about that when I met with the Chamber of Commerce. They really emphasized the need to make sure they've got a strong healthcare system in here, to make sure you've got a strong economy and strong industry and business. And the town took the initiative to put this in its strategic plan to make sure that you've got a direction here for the creation of the health strategy. So just a few headlines. I think one I have to start with is that you'll see the number of people that I interviewed as part of this process, and you've got a strong collection of committed health service providers here. So whether it's the hospital, or the OHT, long-term care, community supports, mental health and addictions, you go down the list. They all want what's best for the community of Ingersoll and for the larger county of Oxford. A lot of partners, everyone says they want a positive relationship with the municipality, but they can't always describe what that looks like, because healthcare providers in the town, you're serving the same public, but you're doing different things, and the town is focused on everything that you guys do every council meeting: police and recreation and roads and waters and sewers. Whereas the health service providers are focused on the care of patients, making sure that the healthcare system is functioning properly. There's a few provincial issues that are really key to this report as well, and one is health human resources. There's a significant shortage in health human resources across the province, in Ingersoll just as much as other parts of the province. So nurses, physicians, lab techs, you go down the list of health human resources that are in short supply these days. Excuse me. Yeah, I think it is getting a bit better. COVID certainly caused some challenges or created some challenges for the system, but certainly getting better. Older age of physicians. So I'll talk a lot about physicians in terms of the recommendations here, but an important stat to recognize, it's not on the slide, that 39% of rostered patients in Oxford have a physician who is over age 60. You compare that to Southwestern Ontario, it's 23%. So 39 versus 23% for the region, and provincially it's 27%. So 27% have of rostered patients have a physician who is over age 60 across the province, but here in Oxford County it's 39%. And then a third provincial issue that's really key, and I'll talk about this as well, there's been a huge, really significant investment in primary care reform across the province. So I'll talk about Dr. Jane Philpott, who the Premier has hired to help with that work that they're doing. And finally, a significant headline is, where's the delineation between the responsibilities for municipal responsibilities and provincial responsibilities? And I'll say right off the bat that the theme you'll see throughout the health strategy is that I'm staying more towards staying in your lane. So make sure that municipalities have their responsibilities that they're required to provide, and don't start dipping into areas that typically the province would have the responsibility for. And I'll give you a few examples as I go through that. So just methodology, as Michael referred to, I was here last fall to present the status report. It was just a lay of the land, so it provided a review of all the providers that are here in Oxford County and the town of Ingersoll. And then stage 2 is this report that I'm presenting tonight. So there's 21 recommendations for town council, divided into areas like policy, advocacy, stakeholder engagement, and I'll go through each of these, or I'll give highlights of some of the recommendations, because there's a lot of information in the report, and hopefully councillors found it helpful when they were reading it. As I referenced earlier, I did interview a number of people, both with the status report and with this recommendation report. You can see the list there. This one was a bit different as we went through the recommendations. Interviewed a number of other municipalities. So other municipalities have done some really interesting things with healthcare, made significant investments in healthcare, and I'll talk about what's good about those and what's may not be so good. And I also met with provincial associations, so the Ontario Medical Association, the Association of Municipalities of Ontario, to get their perspective on the healthcare system. And actually, Michael and I met this afternoon with the Ontario Medical Association, the OMA, and they provided us with a review of, they had hosted delegations at the AMO conference back in August. Municipalities came and spoke to them about what they were hearing from municipalities about the physicians and the work that they do. So they were giving us an update there. So into the recommendations, connections, 2 key partners here in town for sure, the Ontario Health Team and the hospital. The Ontario Health Team, for those of you that don't know what it is or not that familiar with it, it's an organization that's intended to bring the health service providers together. So it's a small team, a very small staff, but they bring the partners together to make sure that health service providers are working closely together. I'm not recommending that the town become part of the OHT. The OHT is typically across the province health service providers. It's not municipalities that are part of that. Although some of the upper tier partners like long-term care, like Mark Dagger from long-term care and public health obviously would be part of it. But a couple of the recommendations for the OHT. I'm recommending an annual meeting of municipal leaders about the ongoing plans in the healthcare system, so that all of you in the 8 municipalities across Oxford, this doesn't need to be unique to Ingersoll, have an opportunity to hear from health service providers about what's going on. Could be in long-term care and primary care, so you understand, and it doesn't need to be overly detailed, but enough for council to understand what some of the plans are for health service providers here in Oxford. And then secondly, it goes the other way, that the OHT needs to hear from municipalities about what are the future development plans in Oxford County. So I met with the county planning department, and I'm recommending that they actually provide a presentation to the OHT members about where future industry's going, where future subdivisions are going, so that they can properly plan for increases in the services that they're going to provide. And then from the hospital side, so very fortunate to have a great hospital here in the town of Ingersoll. They've done a lot of work with the integration work with the town, the Tillsonburg Hospital. But one of the recommendations is that the town's CAO and the hospital CEO meet every 6 months. So when I was a hospital CEO, I met with my municipal counterparts every single month, and we did it for a half hour. And they enjoyed it because it was quick. We do it on a Friday morning, and it really just gave them a lay of the land for what was going on in the hospital. They could ask me questions, and hospitals and municipal councils very closely tied in many ways, because you hear about things if something's not going right at the hospital, or vice versa if something is not going right here. So recommending that every 6 months. It can be more, but it creates a structure for the two of them to meet. And then the hospital CEO be invited for an annual presentation here. So, and I know Nadia has been here before to present. That needs to be part of a structured process so that you hear about any work that's going on there, any other plans. Economic development, and again, this is probably, it could have been in the headline section. The healthcare system is an economic driver. So having the healthcare system strong, sustainable, this is what the Chamber of Commerce folks told me when I met with them, is that that's what they want, so that their employees are getting good health care. A new industry that's coming to town know that they have a strong healthcare system. So making that a real economic driver for the town is key. And the other thing is that from an altruistic standpoint, it helps create a healthy population. So if you have a strong healthcare system, hopefully have a healthy population. And there's some recommendations in there for the economic development director about engaging with business and industry to make sure that connection is solid. A couple smaller pieces, marketing campaign. Lots of municipalities have really strong marketing campaigns to attract healthcare professionals. So videos, social media, lots of things that can be learned from other municipalities about doing that, but I think it's really key to work with your health system partners to put something together for the town and say, this is a great place to be. And co-location policy. Anytime you have new healthcare services coming to town, or industry or service, social services, having them locate together so that there's some synergies between them. And you've got a great opportunity with the new Merck and the new long-term care home coming into town. So it's building on that to make sure that organizations are connected and integrated. And the next recommendations are around primary care expansion, and I referenced this earlier. The government's investing $2.1 billion in addressing the primary care shortages across Oxford County. That's wrong. It's across the province. You're getting a bit less than $2.1 billion. So sorry about that. But it's really important that the town and municipalities leverage that. And I think it gives some more justification for staying in your municipal responsibilities and not dipping into provincial responsibilities. Because if that money is on the table, you have an opportunity to access that through, which I'll talk about in some of the other pieces in the recommendations. But there's a significant number of people in the province of Ontario without a family physician, 2.5 million across the province. So that's huge, and it's growing. In the town of Tillsonburg, you'll see in the report, there's a number of physicians who have recently retired or left, creating some big gaps for having patients unattached with a primary care physician. Next recommendation, and this is really a big one, in Ingersoll, when I was here last September, is really fortunate to have a nurse practitioner-led clinic. There's only 26 or 27 of them across the province. You've got one, so you've already got a baseline from which you can grow. And the OHT with the nurse practitioner-led clinic have been really diligent to make sure that they're at the front of the line for any expansion that's coming in the next round of proposal, or next round of rollouts that will come from the primary care action team at the province. So they're doing great work. They've got a proposal in to expand the number of nurse practitioners here in Ingersoll, but also create a satellite site down in Tillsonburg to address some of the shortages, or the significant shortages of patients down there. And they've already started with some of that, having the unattached clinic in Tillsonburg, which just opened just a couple months ago, so it's fairly recent. And the good thing is that in Ingersoll, in the nurse practitioner-led clinic, health human resources are not going to be an impediment to actually seeing it go forward. There's nurse practitioners that want to work in the NPLC, the nurse practitioner-led clinic, and typically from what I hear, nurse practitioners like to work where they have their own roster of patients. They're not working typically under the auspices of a physician. They have their 800 or more patients, and that's really enticing for a nurse practitioner to have that. So you've got something really great here. The executive director of the nurse practitioner-led clinic and the OHT have been doing some great work, and hopefully when I talk about advocacy, the town can be right there beside them when they're going to the province saying we should be expanded here. Physician support. So there's a number of recommendations around physician support in the report. So first of all, with recruitment. So my recommendation is to create a county-wide physician recruitment program. This will require some financial investment from the town. And you've already been approached to have, when you had that partnership with Tillsonburg and Ingersoll with physician recruitment. But Ingersoll just doesn't have the volume of physicians or the number of physicians that justify having a full-time recruiter. And to have a county-wide physician recruiter working with the local municipalities is a smart investment for the town to take that action. And other counties and other regions have done it. There's a significant reference in the report about Niagara region. So Niagara region has done a great deal of work in recruitment. They've made some significant investments, which I'll talk about. But having that county-wide recruiter who works with your local primary care committee would be a good route to go to ensure you're getting good value for money and getting the support that they need. And maybe I'll just back up one step and to say, for physician recruitment, new physicians coming to town, they want to talk to other physicians to figure out what the culture is and things for spouses to do and how do they, billings and things like that. But they also need an administrative person to help them do the other things that are outside that, because docs are very busy, physicians are very busy people, and to have an administrator like a physician recruiter, it would be a significant support for them. Office space, and I talked about this when I was here last September. The physicians in the hospital right now don't have enough office space. They actually share clinic space, they share office space. And the word that they use with me is that they're in a stalemate, that they don't have office space available. So it's hard to recruit new physicians to town if you don't have that office space. I'll be very clear that the responsibility for finding office space is theirs. It's not the town's, it's not the hospital's, but the hospital and the town need to help that process. And that's why the recommendation is here is that the town lead a process with the economic development director, with the hospital, local partners, including business and industry, to help them find appropriate physician space and office and clinical space. So that's a job to do. It's not really a financial investment that's going to be required, unless, of course, at some point the municipality wants to look at a municipal-owned building that could provide space for physicians, which again is very common. You go around the province, it's everywhere. But I'm not recommending at this time. I'm saying figure out what's the best way to go forward to do that. And then physician incentives. There's a lot of municipalities that provide physician incentives for physicians to come to their town. And I referenced Niagara region already. The city of Welland was giving $100,000 to every physician that came. So they budgeted $1 million, so that's 10 physicians. They've been very successful. They've got a full complement of physicians that have come into Niagara region, but I'm not recommending that. I think you talk to physicians and incentives mean something, but it's not everything. It's more about what's the town like? Do I have spousal employment? Where are my kids going to go to school? Are my colleagues I want to work with? Is it interesting, enjoyable work that I'm doing? Those are the things that they want the most. So I didn't recommend significant physician incentives, but I am recommending some goodwill incentives. So some small incentives to help with relocation. So if you've got a physician who's coming, some relocation, help them cover some relocation costs or small costs like that. And don't ask what the dollar value is, but it's not $100,000, but it's something less that could help with that. And that's something once the physician recruiter, if you go forward with that, could help you figure out what that amount is. A couple of other things that I'm not recommending. So the city of Orillia, they went through a process to actually hire physicians as municipal employees. And they didn't go forward with it. but they looked at a model from Colwood, British Columbia, and Colwood has actually done this. So they've hired physicians as municipal employees working in a medical clinic that's owned by the municipality. They get benefits, pension, vacation, all the things that a municipal employee would get. So it's very attractive to a physician coming. And the majority of those billings are actually coming through the billings that the physician would create through the province anyways, through OTIF, and in BC it's called something different. But I'm not recommending that. It's not, again, you're getting into territory that's outside of municipal responsibility. And someone could stand at this podium and argue the other side of this, but from my experience being around, I don't think it's the right approach. Other municipalities actually provide admin support as well for their physicians. So paperwork is a real burden for family physicians these days. It's really driving them away from the business. We don't have to go far, look at the township of Norwich. So in the village of Norwich, they have the medical clinic there. Those administrative staff are actually municipal employees. The majority of that funding is coming from the physician billings, so it's not coming out of municipal coffers unless they get into a deficit position, which has happened, and then municipal dollars are used to shore up those resources. So again, you're getting into some slippery territory, and I'm not recommending those, but it's in the report. If you're interested in hearing more about it, you can certainly look at that. In advocacy, I've talked about this a couple times. The mayor has done a great job the last 2 years going to AMO, talking to the parliamentary assistant to the Minister of Health about the expansion of the nurse practitioner-led clinic. But health system partners want the town to be there beside them when they're advocating for new investments in the healthcare system. So it's a great thing to do. And the town brings leverage, the town brings position, the town brings importance to conversations. And when the mayor shows up, the elected officials provincially are probably more likely to listen to, not more likely, but they're going to hopefully listen to the local mayors, and mayors bring the voice and the position of the municipality. There's a number of, or a couple of long-term care needs that are relevant for the town, and this again is around advocacy. There's a great adult day program. An adult day program is where people living with dementia can bring their loved one to Whittingford Lodge, typically in Woodstock, where they get supports for the day, some respite care, but it's funded year to year. So the funding could dry up tomorrow, and that's something that as a town is very beneficial to you and any of your loved ones. The other thing that's really interesting about Oxford County is you don't have a behavioral support transitional unit. So this is where people with significant behaviors, dementia, very challenging to support in a long-term care home. There's special facilities, special homes, not facilities, special homes that have been created in London, and Grey Bruce just opened one. And again, that's something that Oxford should be advocating for, because if not, those difficult to care for patients stay in hospital, which means you have more hospital beds that aren't available for other people that need care within the hospital. So important thing to advocate for. And then finally, there's a lot of other smaller recommendations within the report. Future consideration. So this is something that I put, at the start I called it a stretch recommendation, but some of the providers, when I gave them the draft report. So I circulated this draft report to all the people that I interviewed. So OHT, hospital, you go down the list. They all had a chance to look at it. They provided lots of feedback back to me. I didn't necessarily agree with everything that they were saying, because it's a position that I'm bringing to the table, but lots of good advice, and they were very helpful. But in this neighborhood model of primary care, there's a couple of diagrams at the end of the slide deck here. This is what the primary care system looks like today. So you get primary care based on who or what organization you're connected to. So you go down that list of patients in the blue, the green, the purple, and the green. They can be connected to a group practice physician, the nurse practitioner-led clinic, a community health center, and that's how it dictates the level and type of care that they get, not quality of care. So I don't want to say anything about any quality differences between those organizations. But the patients in the orange at the top are the unattached patients, so they don't have anywhere to go. So this is really, it's the way the Ontario healthcare system works. It's been there for many, many years. But the importance of having access to primary care can't be understated. So there's been numerous studies year after year showing that if you have primary care where you can get access same day or next day, the quality of the health of the population increases considerably. So that's what the goal is here. And the reason I bring this to the municipality is because we could do something different. And Dr. Jane Philpott, who is the provincial person hired by the Premier to roll out the $2.1 billion, she provided this. She's wrote a book called Health for All, and in this report talks about a primary care home. So you actually, instead of accessing care based on who you're connected to, so a patient's connected to a nurse practitioner or a doc, instead every patient within a geography is connected to the primary care system. And all the primary care providers work together. So that would be nurses, nurse practitioners, physicians, social work, dietitians, counseling. And it's based on a geographic model. And the example that Dr. Philpott uses is in the school board. Would you ever consider to have a child who was only connected to a school, and if they weren't connected to that school, they wouldn't be able to go to school? Like everybody within a geography gets access to a school. So why don't we have that in the healthcare system? And this exists across the world. Other developed countries have this. So this is something food for thought. It's not a recommendation that I'm expecting the town to move forward with. But the reason I bring it here is that if it's geography, you could do this in Oxford County. Like Oxford County, you've got significant shortages in primary care, but relatively stable. So there's no hospital supervisors in here. There's no emergency department closures. It would be a great geography to use to have everyone within Oxford County having access to a primary care provider. And a provider is not just a doc. It can be the variety of people there. So I'll wrap up there. I could talk more and more about the future consideration, but happy to answer any questions. Again, really appreciate the town giving me the opportunity to prepare this report, and hopefully it provides you with some direction to move forward in terms of how you'll interact with the healthcare system in the future. Thanks, Mr. Mayor.
Thank you very much. Questions from council? Councillor Hallery, please.
Thank you very much for that report. I just wanted to find out if you had a chance to interview the recent doctors that left Oxford County in the last year.
I have not. So the physicians that I interviewed were the Ingersoll physicians, and the only one that I'm aware of from Ingersoll is the one that, I forget his name now, who was off-site from the hospital. But I didn't interview any of the Tilsonburg physicians.
Thank you.
Others or questions from council? Go ahead, Councillor Hallery.
Okay, so is Oxford County part of this report recommendation, or is it just our Ingersoll Tilsonburg Hospital?
This is prepared for the town of Ingersoll, but there's several of the recommendations that can't be just Ingersoll. It needs to be something bigger, and the physician recruitment is a really good example. I'm talking about having a county-wide recruitment program.
Okay. Because the reason I ask is because when we had a recent celebration in Woodstock for a new doctor that came, and then the next thing I heard, he was leaving, and I had the pleasure of meeting him and asking him the questions, why are you leaving? And he mentioned exactly these two things that I just noticed in the report. Administrative support for physicians was his biggest thing. He came from England. He says it's double the work, no support, and then we kept changing the MAs on him, and he said he couldn't cope with that. And then the second thing he said was the incentives that were promised, just like you mentioned, were promised but never delivered. So the frustration of settling down, I think he said he was promised 30,000, wasn't as much as 100, but he never got it. So I'm wondering where we dropped the ball even when we promise and then they come, and maybe we miss out on someone really looking to stay long-term.
Mr. Mayor, if I could respond?
Please
sorry.
do.
So I think having a physician recruiter to help the town of Ingersoll would help address some of those issues, because if you have volunteers, well-meaning volunteers trying to navigate some of these incentives that could be provided, It's not their job, right? They're doing it for a volunteer basis. Physician recruiter, this would be their responsibility, and you would have someone that you could hold accountable for a misstep like that where they didn't get their incentives. And just the UK part, Niagara region, that's where the majority of their 24 new physicians came from, is the UK. So they're mid-career physicians that were enticed by this additional money, but came and started up practice in Welland and Port Colborne, places like that.
Councillor Van Kooten-Bosens, please.
You talk about the foes that we have here in the town of Ingersoll. Is there room, did you discover whether or not there is room within those foes to be able to have more doctors join them?
Yeah, I'm not, and Mr. Mayor, through the councillor's question, I'm not the best guy to answer it specifically, but from my conversations with them, they said that they do. So, and the impediment right now is office space. So if they don't have the office space, they can't start going out looking for physicians because they don't have any place for the physician to hunker down.
So I feel like I'm going to put Curtis maybe on the spot here, but I know that we used to have a countywide physician recruitment. It kind of went by the wayside. We do have our own physician recruitment committee. I mean, one of the recommendations is that we go back to having an Oxford County. Do you see that being an option even for us? Has there been a change within the county of being able to have those conversations? Because there for a while, it just wasn't working. So I apologize for putting you on the spot, Curtis.
Yes, go ahead, Curtis.
Yeah, it's a conversation that we can certainly have. I know there's been interest in partnerships with the town of Tillsonburg in the past. The town of Tillsonburg has reached out to us to partner. We were waiting on some of these recommendations to determine what we would recommend as staff. And then I certainly work very closely with Woodstock Economic Development. They have a part-time physician recruiter in Woodstock as well. So we've had conversations about what it might look like. The Oxford County wide group was largely ineffective. The way it was established, it was all volunteers, and the majority of the money was spent on print ads, and we tried a few different things, but we weren't very effective as a group. So I think having these recommendations and having those conversations, there's an opportunity to explore it. I can't guarantee whether anything's going to come of that, but it's something that we can certainly discuss and determine whether there's appetite for it, whether there's a model that we can put forth for council's consideration.
And I can just add to that, certainly from a county council perspective, there was a request for a countywide, but it just wasn't, it wasn't a fully mature idea at that time. And really now having done the work that Ingersoll's done with this, that's something that can start those conversations and fully inform everyone who's wanting to go have a look at this to have that knowledge, so we can again see where it's effective to put that information, the resources, and the right way to do it. So if we do join that group, we know that we're comfortable going into something that we have the information to support. And I think that's really the gem of all this, is this information that we received, so we can have that knowledgeable conversation with everybody around the table about what's effective and what's not. And I think that not only will Ingersoll benefit from this, all of Oxford County will. So we're kind of doing something for everybody. And I know that when Michael and with CEO Graves and I met with MPP Hardeman, he was very interested in this. He was asking for this. And at AMO, when we've met with the ministry both times, they were very interested in sharing the outcome of this. So I think when we go and we say, here's what we've done, the research, we have the information, here's what we can do. Are you interested in that? And where does that fit into what you're doing with the primary care and what everybody else is doing with primary care? Then that we can see where we fit in there and make those conversations happen. It's hard because again, as Mr. Barrett mentioned, we don't do things a lot at the municipal level as far as healthcare goes, so that knowledge level just wasn't there. And I certainly didn't have it. I feel much more comfortable with this, having those conversations with colleagues around the county to be able to see, and I'm sure Michael does as well, to be able to see where we can fit into that. I don't know if that helps. Good? No, I'm good. Councillor Hallerow, please.
Thank you, through you, Mayor. So one of the things that I have experience with is definitely an example from Brampton when we tried to recruit physicians. That was what the municipality was more involved in zoning areas which they wanted to have physicians accessible towards the new William Osler Hospital when it was being built. So I wonder if that's a model that we can do is, we know that we don't have space in the hospital, but we have some buildings in town that we could zone physician, friendly, and then have that as something that we market to attract physicians. And I think that's a very simple way to do it, because we do know in many places, physicians are willing to spend the money to get the space and to retrofit the space for themselves. And that's kind of how we can come in, where without even making any financial contributions to that, we just zone some specific areas and use it as a starting point to market.
Sure. For sure. So you look around the province, there's many, many municipalities that have done this. They start with the zoning, but they also go into municipal ownership of the building. So Kincardine, Goderich, go down the list of small municipalities that have done it. It's a step the municipality will have to decide whether they want to take, because there's a financial implication to that of buying the building. If you've got a building that makes sense in terms of creating for physician offices, it's something you could do. But you need to, this is the job of councils, to figure out what's the balance between how much you take out of your municipal tax base to pay for something that typically isn't your responsibility. But Councillor, there's many, many municipalities across the province that have done this, and it's an option that you can look at to explore.
Just to add to that, today we're really accepting the recommendations, and then we can, part of that is to empower staff to go and look how they bring back different ideas to be able to make those recommendations happen and fulfill them. So there's lots of work ahead to do, but this is really this is the strategic plan that will guide that work, like we're regularly doing in Ingersoll, to be able to have those things come to fruition. So I think there's so many opportunities that come from this, but with not having this, you're not going in a specific direction. Deputy Mayor Wilson, please.
Thank you, Mayor, through you. My question is around the Heart Hub, and so it's a bit of a niche question, and I can appreciate that maybe you don't know any more than we do. So it touched on the importance of making sure that the residents of Ingersoll can access the physical space for addictions and treatment in the city of Woodstock, which is a concern that I have too. Is there anything you can elaborate on in terms of kind of how we could foster that connection, ensuring that the residents do have access to something that won't physically be where they live?
Right. So that's a really good question, and that's the purpose of having those comments in the report. Being 20 minutes away in Woodstock, is that how long it was? 20 minutes? Yeah. You could see those the people that are accessing those services are going to be more Woodstock focused, and that was the purpose of this report, is to say this is a county-wide service, and that's their full intent. So you speak to the Woodstock Hospital, to the OHT, they've said very, very clearly that these are county resources. It's not a city of Woodstock resource. And this is a suggestion that came from Teresa Martins, who's the OHT executive director, is in addition to making sure, it was kind of directive saying making sure that Ingersoll residents have access to it, have council learn about the Heart Hub so that you're aware of it, and then you can advocate properly to make sure if you're hearing that some of your residents aren't getting access, that you have an ability to, you understand it first before actually saying you want to get something changed. So that was some good advice to me from the stakeholders.
Further questions? Councillor Hughes, please.
Thank you. This is more of a question, I guess, for either staff or the administration. Now that we have received this report, or will be receiving this report, will the current physician recruitment and retention group or committee research with meetings to discuss this health strategy and be able to report back to council in regards to some of this?
Mr. Graves.
Yeah, so we're already reaching out to other CAOs across the county to see if they want to do something jointly. And so we're going to use this report to go to them to say, here's what we have, here's what the information is. I think they'll be delighted to see something, because they too have been working in a vacuum without real health advice. And most of them are not working in the health field either. So we think that'll add some credence to that. We're hoping to convene a meeting. Once we get that going, we should be able to put together some sort of a group. I'm not sure that we'll get county-wide involvement.
Just for clarity, I think Councillor East's question is about our own primary care committee.
Yeah, and, but I think we would like to do this first to try to establish that, to see if we can have that up and running, and then get some feedback from the primary care committee on what we intend to do with that, so they have something to work from to know who's going to be involved in what they're doing, so they can see that.
Councillor Van Kouten-Bosens.
Okay, so off of that then, I mean, you've talked about, Mr. Mayor, about, you know, where this report is going to go to. So I'm going to ask Michael then, how are you going to take the recommendations then and like if we decide to go ahead and implement as what the motion is asking us to do, is implement this, how do you see this going forward, and how are you going to break down all these recommendations? I mean, there's 21 recommendations, which is a lot. I mean, I don't foresee us being able to do everything all at once, obviously, but are you going to come back to us as a council and say, okay, this is where staff feel that we should be going now, and this is what we can do? Sorry to put you on the spot, but if you can give us kind of a lay of the land of what you're thinking.
I'll allow that question, but then I'll just ask if there's any more questions for Mr. Barrett, and then we'll have a motion.
So, yeah, so staff will take a look at this, and they'll start to develop their plan and how they implement this. Some of these will have budget impacts. Some of these will be reviews of existing policies. We may look at our community improvement plan as we tend to review it, to look at incentives that we could provide. That might be one of the ways that we provide incentives. Some of them are advocacy. Some of them are joining with our partners. So we're reaching out to our partners already to say, what can we do together to do this so that we can ensure that we're implementing this across the board. You know, so it'll be, you'll see some recommendations coming forward in the budget that will say, here's how we intend to implement this, and you'll see some of it as we just are implementing things, getting feedback from our partners to say, here's how we intend to do that together. So it's going to be a wide range of ways and methods that we put this together. So I don't know if you got any other questions, but you'll see some various information from us. Could be reports, could be budget, could be different policy reviews that will have reference this report in it to say, here's what we're intending to implement.
It's a follow-up on that, though, and it impacts on what I'm going to put as a part of my motion. So that's why I'm asking the questions I am. Is this going to come back before council again, or are we just accepting all of the recommendations? I mean, you know, what if there are some recommendations in there that as a council, we don't feel we should be going forward with? Like, I guess I'm asking, like, we're essentially blanketing, no offense to you, please understand this. I know you're an expert in your field and appreciate all of the recommendations you put forward, but it's 21 recommendations that are coming before council that until tonight, maybe I didn't understand some of them because we just received this report. So I'm just wondering, I'm wondering whether we accept the recommendations tonight or whether we give ourselves a chance to go back and read through all the recommendations now that we've heard from Mr. Barrett as well tonight and be able to digest all of that. It's a big report to digest, and the recommendations are there. And I'm not saying that I don't agree with them. It's just, I think that us being able to have a bit more of a conversation about them, because then we're really putting it all on staff's head in that respect of being able to choose what recommendations go forward. And council then, it is, I guess I'm asking, does it come back to council to say at all, at any time, these are the recommendations that we're feeling as staff? How does council feel about that? That's, I guess that's where I'm asking, because otherwise we're essentially blanketing 21 recommendations tonight.
Well, the only thing I would add to that is staff did send this out on August 28th, so we did have it for a couple weeks prior. If there's anything in there that's specific, I know that Mr. Barrett's recommendations are there. We will, like staff will, there will be an opportunity to implement this because there'll be budget considerations, there'll be stuff coming back. It's just, I don't know. I guess to answer your question, I don't know how I feel about council picking and choosing recommendations that were made. Is there any specifically in here that may affect others? Like, does it affect the integrity of the report? Mr. Graves?
Oh, I think those are valid points, but at the same time, council can do with this what they wish. It's here for your presentation, and you can defer, you can adopt, you could point out recommendations in here that you would like staff to focus on first. That's an opportunity. What we would likely do is take a look at these and say, here are some of the ones that we think are important and we're going to focus on. Council will recall from our corporate strategic plan that we had a lot of goals in it, and we started to work on almost all of them all at once. And we've been systematically doing a report annually to say, here's where we're at on that, and we've been checking a lot of those boxes off. We would handle this in the same way as we do that, right? We know some of them may be easier to implement than others. Some of them involve other organizations, so it's difficult to say when we would get buy-in and how that would proceed. So we would likely do a report annually, unlikely the same as our full-blown strategic plan, that we would say, here's where we're at, and here's what we're focusing on, and here's what we've accomplished, and you'll see budgetary impacts that'll come out of those.
I'm going to go with Councillor Hudson because she hasn't spoken yet.
Thank you, through you. I kind of had the same worries as Christy, and it's nothing against the report. It's just a lot of recommendations, and I was just kind of wondering, like, who's responsible for the actions, the timelines, the accountability, and the outcomes? Like, are all staff going to be part of coming back with the recommendations, or how do you choose who's going to write the timeline, who's accountable, who's going to write the action plan for each one of those 21 recommendations? That's
So again, there's a myriad of different things that would have to happen, but with any policy that council passes or adopts, it's given to staff and the administration, who's run through the CAO, and he would through his staff of who choose who would be the best to do that and report back. Now, council can always ask for further reports, specific information. The accountability does come back to council of if we're going to adopt this, how does we want to see it implemented. But at the end of the day, we would hand this over to staff. And I think that's the important part here, is that we do hand it over to staff so they can start working on these. My worry is that if we pick and choose which ones, and we're not qualified to do that because we're not healthcare providers and we don't have the staff level, is going out, working with our partners and making sure that those things, that staff can come back and go, this isn't feasible, this is a recommendation, but it's not feasible because of A, B, and C. So we don't recommend you do that. But I think having that exploration and having that happen through the staff level is a good way to do so. Again, we have that future consideration. That's big change. It may or may not be possible, but I think having those conversations and allowing staff to come back and see where these end up and give us those further recommendations. Again, we're here to set policy in a direction and let staff do the implementation of it. Does that? Councillor Halleru, and then Deputy Mayor Wilson, please.
So my question is, why aren't we recommending that the Physician Recruitment Committee take a look at this? Because all of these recommendations are good recommendations. It doesn't mean we have to adopt all of them at the same time. I feel like it does require community to come to the table to also have an idea of what this is. The hard work has been done by professionals like Mr. Beer. We now need to decipher what can we do first and what can we do that benefits us as a community. I see this as something that implementing this, making us look like the example that Ingersoll has done, can also translate to other communities that want to eventually take. I don't think we need more technical people to review this because it's very simple language. We've already understood it. We just need people to basically prioritize what we can and cannot do before it becomes such a big impact on our budget. And I think it's a lot to give staff to take away so much time from others. But having a committee of members in the community review this and recommend back to council a shorter list, I think could be a really good starting point.
So I certainly think they can be a part of it, but again, they don't have the information to be able to implement this. This is advisory committee. It's a primary care and retention advisory committee, so there's certainly a role there, but certainly not all of these things are something that they would have roles of parts of these recommendations, but there's parts of like advocacy and different things, there's different portions of that they would not be able to have a role in. So, and I think I trust staff to be able to hand that off and take that to the committee where they need to. Same with other committees that can have that. But Mr. Graves, would you like to?
Yeah, just that we don't have any problem sharing the report, but I think they're going to immediately ask who's going to be involved in this, and so they're going to want to know right away. So we'd like to get them that answer as quickly as possible so that they have an idea what their role is in conjunction with everybody else. That's the first question I would ask, so.
We are going to take this back to the recruitment. Okay. I just wanted to be clear that they still get an opportunity to take a look at this from the perspective of being community and professionals in our community. All right. Thank you.
Mr. Barrett?
I think just add a couple comments. One is the recommendation around the local physician recruitment committee is that the economic development director be the one that look at strengthening it, adding new accountabilities, what the structure is, to make sure the deliverables get delivered. That's what it comes down to. The report was circulated to Melanie, who's the chair of the local physician recruitment committee, so she's had an opportunity to look at both the status report and this report. I said to Michael this afternoon, I've overshared this thing. Like it is, I've tried to make it, because last thing you want is for some guy to come from out of town and say, this is what you need to do. It needs to be the voice of the people. So, and last point, Mr. Mayor, I'll make is that it's, when you have a number of recommendations like this, it's an implementation plan. And it's just building on what Michael said, is that each of the recommendations, you come back and say, well, we're working on these ones. These ones are going to pause or we're not going to do. And then council can see where you're advancing these recommendations, so you stay on top of it.
Thank you, Mayor, through you. I mean, coming back to Councillor Van Kootenbossen's comment kind of at the beginning of that part of the discussion, I think it would be helpful for council to kind of understand what it means to implement the 21 recommendations. I wouldn't want to go through and pick and choose, but if staff could at least prioritize and give us an understanding of what it would mean, what actions would need to be taken to accomplish those recommendations, I would have a better understanding of what it will take to actually achieve what has been recommended in the plan. So I don't want to pick and choose which ones we do or don't do, but I'd like to hear from staff how this turns into being implemented, what needs to actually happen to execute the recommendations that are in the report. That for me would be kind of the staff report that I would like to see at some point, not piecemeal over whenever kind of things come through the budget or a policy comes forward. It would be nice to have an overview from my perspective.
The only difficulty with that, if I could, Mr. Mayor, is that some of these involve a bunch of other agencies, so I need to have some direction if I'm supposed to be going out to meet with them to talk about it so that I can get some information so I can bring it back to say, is this possible or is it not possible? So adopting is to try and direct me in some capacity. Some we can definitely put some work to try to say, here's what we think this will do, but we need to gather some information, so.
Councillor Van Kootenbossen's.
So I'm hearing what the Deputy Mayor is saying, and I don't disagree, but I'm also hearing what you're saying, Michael, in the respect that I think that you are going to bring back, I think you need to go and explore, you need to go and see how the priorities can fall, and then be able to bring it back to us. I think more than anything, we're just looking for a piece to come back to us at some point, and it's going to take some time. I don't think that this is something that's going to be implemented within the next year. I think there's some things that can be implemented within the next year, but I think there's some things that are a 5-year plan. But being able to see where those priorities lie after you've done some exploring, after hearing what things have been said, I don't have a problem in directing staff to implement the plan, but I'm just thinking that more than anything, we're looking for something to come back to us at some point. And I don't think that would be without not in your realm. I think that you could probably do that and bringing it back, and it might not be right away, but does that make sense? Does that help?
Yeah, and I think a good portion of this is going to come back in your budget process, which we're not very far off of at all. So I think you're going to see a report that's going to outline a fair number of these in your budget process.
Yeah, and I've heard the CAO state that there will be an update, which I think is valid with all strategic documents that we have. We need to don't measure how we're doing. So I certainly agree with that. It's just, we do need to be prepared that staff will come back and say that we don't recommend, after looking at this recommendation, we don't intend to recommend that we put it forward because it's just not feasible at this time, right? So is there any more questions for Mr. Barrett at this time? Seeing none, thank you very much. I know it's not easy job to have a lot of conversations with people who are passionate about what they do. It's also a very good thing to have conversation with people who are passionate about what they do. So I thank you for that and the work that's been done here. Because again, it's not only going to benefit, I think, the town of Ingersoll, but the wider region, and hopefully be a model going forward of what happens when we work together. So thank you very much on behalf of council and the community. Councillor Van Kooten-Bossens, please.
Thank you, Mr. Mayor. Moved by myself. Deputy Mayor Wilson can say whether or not she's going to second it, but that the Council of the Corporation of the Town of Ingersoll receive Michael Barrett's presentation of the Town of Ingersoll's health strategy as information, and that Council adopt the strategy dated July 11th, 2025 in its entirety and direct staff to implement the plan, providing further reports as required.
Deputy Mayor Wilson, second? Nice. Okay, with motions on the floor, discussion. Yes, absolutely, Deputy.
So
Councillor Van Kooten-Bossens.
I'm hearing, and I have the same concerns, but I am hearing that our CAO is probably going to be at the helm of this. I do trust that you're going to come back to us. You're going to talk with us. It's not something that you're just going to go willy-nilly. That's not how you do things. A strategic plan has always come back before us as well. I think we're just trying to make sure that the 21 recommendations at some point come back before us as to whether, I have some concerns over some of the recommendations that I don't think that they're feasible. I don't think that monetarily wise that they're feasible in that respect. But I do trust that we have put the right people in the places that we have. And so that's why I have made the decision to put forth the recommendation and the motion.
Thank you very much. Councillor Halleru, please.
Thank you. Just listening to Mr. Barrett to give us this, he continuously said he had heard a lot of recommendations. He didn't think to recommend that to Ingersoll. He had heard a lot, and he didn't think to recommend some. So I do believe that the 21 recommendations are recommendations that fit and are appropriate for us. I just feel like we can't adopt all 21 at the same time. So we do need people to take that time to go through. And like you said, it's going to come back to the physician's recruitment. That's kind of what I want to see, that it's conjunction between staff and the recruitment physician committee going through the options. Because I know there's some things that are very simple here that could easily be implemented by just community members realizing what their priority is and sharing that with staff so staff can also have their priority. And I think I understand that you do have to go get some partners on board before you can even have some direction. But as long as we are in agreement that it's going to be together with community and staff, I'm good to go with the recommendations, going to Mike to take the lead on this.
For discussion? Having this information is key. We now know where our lane is, to kind of quote Mr. Barrett, that where we do, it's a murky world out there. Our residents don't care who provides health care. They need it. We need it ourselves. But at the end of the day, it does matter to ratepayers who's footing the bill there and where that is. And it can be a slippery slope about who's providing what, because our province has shown time and time again, they're very eager to download items. I have a report on county council tomorrow about paramedic response times and offload times. And so there's that overlap between municipal-led healthcare and provincial-led healthcare, where we can be more effective, and we want to be more effective. We said that as a council or strategic plan. We want to be more effective and supportive of our healthcare system. This is a plan to be able to do that, correlated by the expertise that Mr. Barrett has, but also from the information provided by our expertise and our people in our community that provide these services. That's 100% important, because they're the people on the front lines doing this every day. They know the system they work in, they know the benefits, they know the pitfalls of it. Now we can hand off to the experts that we have here on how do we look at and explore those options with those partners and see where they fit the town of Ingersoll, and how do we put effective dollars to use so they're not wasted. Being a member of this, when we had this physician recruitment question before, well, is $100,000 enough? Well, maybe it needed 125 and we just threw $100,000 down the drain because we didn't put enough into it. Or maybe we spent 250 when we only need to spend 100. So it's about having those conversations and doing the work ahead of time to be able to be effective with our ratepayers' dollars and not step into someone else's world and step on people's toes that we don't need to. So I think this gives a choice, a way forward. It gives the direction to staff to have those conversations, us to have those conversations when it comes to advocacy, and build those relationships up so that we can make have the best healthcare outcomes for our residents that we can. There's a lot of things out of our control, but we can try to advocate for those things and create the best atmosphere. So I'm certainly supportive of that. And I think that by adopting this, we give staff more tools, more work, but more tools to be able to do that work appropriately. Further discussion? Oh, Mr. Graves.
I really appreciate the comments of council during this. We'll take them under advisement as we implement or as we develop our implementation plan, and we'll make sure that we report back on what that looks like.
All those in favor? Opposed? That's carried unanimously. At this time, we do have, it's 7 o'clock. We will go into a public meeting. I'm just going to ask for a 5-minute recess prior to that. Councillor Van Kootenbossens, Deputy Mayor Wilson, discussion. All those in favor? Opposed? And we'll start right at 7:05. Thank you. Okay, I apologize for our tardiness. We went 3 minutes over. So we will get things going here so we can get everybody back home on a beautiful evening. I'll get my proper paperwork here. There we go. I declare the public meeting to be open. This meeting is being constituted as a public meeting held under the Planning Act to consider proposed amendments to Consolidated Zoning Bylaw 044160. Any person in attendance, including those participating virtually, may make a presentation to council in support or opposition of the zone change application. Individuals who wish to receive the decision of council on any decision or any application being considered this evening must sign the record of attendance outside of council chambers or submit a written request to the attention of the town clerk, Danielle Richard, at danielle.richard@ingersoll.ca. The Ontario Land Tribunal has the power to dismiss an appeal under subsection 25 if an appellant has not provided council with oral submissions at a public meeting or a written submission before a bylaw is passed under this section. This application to be heard this evening concerns application ZN 6-24-03 583530 Hamilton Road, South Thames Development Incorporated, Glen, Schnarr, and Associates, Inc. Does any member of the council have a conflict of interest on this application to be considered? Seeing none. Has the clerk received any additional correspondence on the application that is not being noted on the agenda?
Two additional items of correspondence were received, one from a Mr. Terry Harrison, and another from a Ms. Tammy Betzner. Both items of correspondence have been circulated to council and will be reflected in the public minutes.
Thank you very much. Just before we get going, because we do have quite a few people here for this application, when it comes to public comments, when it comes to whether it's any presentations, I would ask everybody to refrain from any sort of clapping in positive or negative. We want everybody to feel comfortable coming up to saying what they have to say and being respectful, and we're here to have everybody be heard. So we want everybody to have that chance and feel comfortable doing so, so that's why I asked that happen. So I'll now request that Planner Heather Sinclair to provide an overview of the application and an explanation of the requested zoning amendment, please.
Thank you, Your Worship. Applications have been received for draft plan of subdivision, official plan amendment, and zone change for the lands located at 583530 Hamilton Road, which is located on the south side of Hamilton Road, west of Oakwood Street. The applications have been submitted to facilitate a residential plan of subdivision for the creation of 582 new parcels for residential development, consisting of 243 parcels for single detached dwellings, which are shown in yellow and gray on plate 3 of the staff report. 53 blocks for the development of street fronting townhouses, which would facilitate the development of 339 new lots for street fronting townhouse dwelling units, which are shown on orange on plate 3. 2 blocks for parkland, 2 blocks for stormwater management and a servicing corridor, 1 block for an environmental buffer, 1 block for a buffer from Hamilton Road, located on the north side of the subdivision, 1 block for a buffer from the adjacent rail lines to the south. And the subdivision also proposes a new road network consisting of 10 new streets labeled as streets A through J on plate 3, with 1 direct access road to Hamilton Road, as well as an emergency access to Hamilton Road on the northwest corner of the subject lands, and 2 future access stubs on the west side of the subject lands, as well as 2 blocks for the retention of the existing woodlands that would be retained by the developer. The subject lands were incorporated into the town of Ingersoll as part of the boundary adjustment with the township of Southwest Oxford in 2021, and were subject to a recent official plan amendment to adopt the Southwest Ingersoll secondary plan, which was completed in 2024, which redesignated the subject lands from agricultural reserve to residential in the town's land use plan. The application for official plan amendment has been requested to permit an increase to the overall net residential density for low density residential designation from 30 units per hectare, or 12 units per acre,
to 40 units per hectare or 16 units per acre. And an amendment to the existing official plan residential density configuration would also be required to facilitate the draft plan of subdivision as proposed. Specifically, the current residential density arrangement in the official plan identifies lands along the northern portion of the subject lands as being designated medium-density residential, with the remainder of the residential lands on the subject property being designated as low-density residential. And the applicants are now proposing to establish a mix of single detached dwellings and townhouses throughout the subject lands, with that proposed density increase to 40 units per hectare. An additional special policy will be required in the official plan to permit a proposed Class 4 noise area along the southerly portion of the subject lands, to implement a recommendation from the submitted environmental noise study, which has been peer-reviewed by an acoustic engineer consultant engaged by the town and the county. An application for zone change has also been requested to facilitate the proposal. The subject lands are currently zoned General Agricultural Zone in the Township of Southwest Oxford zoning bylaw. An amendment to this zoning will be required to bring the lands under the jurisdiction of the town zoning bylaw and to facilitate the proposed future residential development. It's proposed that the portion of land for single detached dwellings would be rezoned to a special residential type 2 zone to permit the proposed single detached dwellings, as well as a number of site-specific amendments to the development provisions of the R2 zone, which would include a reduction to the lot area requirement from 345 square meters to 270 square meters, and from 450 square meters to 360 square meters for a corner lot. A reduction to the lot frontage requirement from 11.5 meters to 9 meters, and from 15 meters to 12 meters for a corner lot. A reduction to the minimum required front yard depth from 6 meters to 4.5 meters. A reduction to the minimum required exterior side yard width from 6 meters to 3.5 meters. A reduction to the minimum required rear yard depth from 7.5 meters to 6 meters. A reduction to the minimum required interior side yard width from 3 meters on one side and 1.2 meters on the other side to 0.6 meters on one side and 1.2 meters on the other side, provided that a combined total for each interior side yard width would be 1.8 meters. And an increase to the lot coverage allowance from 40% lot area to 45% plus 50% to include accessory structures. It's further proposed that the lands intended for the development of the townhouse dwellings would be rezoned to a special R3 zoning, with additional site-specific amendments to the development provisions of the R3 zone, including a reduction to the lot area requirement from 240 square meters to 216 square meters for an end unit, and 330 square meters to 228 square meters for an end unit on a corner lot. A reduction to the lot frontage requirement from 8 meters to 7.2 meters for an end unit, and from 11 meters to 7.6 meters for an end unit on a corner lot. A reduction from the front yard depth requirement from 6 meters to 4.5 meters. A reduction to the exterior side yard width from 3 meters to 3.5 meters. A reduction to the rear yard depth from 7.5 meters to 6 meters. A reduction from the interior side yard width from 3 meters to 1.5 for an end dwelling unit, and an increase to the lot coverage allowance from 40% lot area to 50% lot area, and 60% to include an accessory structure. Requests were also received to increase the maximum height allowance from 11 meters to 12.5 meters, and to reduce the minimum lot depth requirement from 30 meters to 27.5 meters, for both the proposed R2 special and R3 special zones. However, the applicants have indicated that these amendments are no longer necessary. Additional zoning amendments would be required to recognize the existing environmental features and recreational lands for the proposed development through the implementation of an open space zoning and a recreational zoning. In support of the applications, a number of studies and reports have been submitted, including an environmental impact study and tree inventory and preservation plan, an environmental noise and vibration study, a transportation study, a functional servicing report, planning justification report, geotechnical investigation and hydrogeological assessment, a floodplain analysis, and an archaeological assessment. These subject lands do currently contain an existing single detached dwelling and are in agricultural production, and land uses surrounding the property include agricultural lands in the township of Southwest Oxford to the west, the Thames River and floodplain lands regulated by the Upper Thames River Conservation Authority to the north, existing residential parcels to the northeast, industrial lands to the east and south, and the Ontario Southland Railway and Aero Transportation Reloading Yard to the south. The proposal will be reviewed under the policy direction from the provincial planning statement and a range of policy criteria from the county's official plan, including the county's policies respecting residential uses, environmental policies, noise and vibration policies, transportation policies, limestone resource policies, and the special policies that have been implemented through the Southwest Ingersoll Secondary Plan. Notice of the applications and the notice of public meeting regarding the proposal was provided to surrounding property owners in accordance with the provisions of the Planning Act. 4 letters have been received that have been forwarded to Council outlining a number of concerns with the proposal. And summarized, these include the extent of the proposed density increases, the extent of the requested variances to the town zoning bylaw, concerns with respect to how stormwater will be accommodated, particularly in light of the proposed densities and the increases requested to lot coverage, fire protection issues, snow removal issues, parking issues and concerns about visitor parking extending outside of the subdivision area and onto Hamilton Road, traffic concerns, particularly with regard to the proposed single entrance on Hamilton Road and the impact that this will have on traffic movement for both the development and Hamilton Road as it currently exists. A comment was received requesting a wider buffer strip between the proposed development and Hamilton Road. Concerns were received with respect to how the proposed development would accommodate the additional residential dwelling units, or ARUs, which may have impact on parking and stormwater management. Concerns were received with respect to how construction nuisances would be dealt with specifically with respect to noise, odor, and vibration and dust. Concerns were received with respect to the proposed front yard depths and lot frontages, indicating that they would not be sufficient for private parking. We received a comment indicating that the future road stubs on the west side are unlikely to be utilized, and one comment noted the presence of an abandoned cemetery to the southwest of the subject lands. So, Council, overall, this is an overview of the proposal and the public comments that have been received to date. Planning staff will follow up with a subsequent report outlining all the comments received from the commenting agencies, as well as a recommendation at a future meeting. Thank you.
Thank you very much. Does the applicant or the representative have any comments to make concerning the application? Please come forward to the lectern, and your presentation, I believe, is there.
Good evening, Mr. Mayor, members of council, staff, and members of the public with us tonight. My name is Mark Condell. I'm a planner at Glen, Schnarr and Associates, here on behalf of Cache Homes, the owner and applicant of the subject matter here tonight for tonight's public meeting. Tonight I am accompanied by Mr. Marcus Gaglieri, Ms. Erica Forrest of Cache Homes, as well as Ms. Erica Bailey, our traffic engineer with Paradigm Transportation Solutions. Mr. Mayor, I do very much appreciate the overview provided by Ms. Sinclair. It was very thorough, so I will augment my submissions tonight just to avoid repeating some of the details that were presented tonight and to be respectful of everyone's time. But there are a few items I'd like to just speak to as it relates to the application, and I'll just jump ahead to a few slides, if I may. And to speak to the proposed development, and as noted by Heather, the applications that have been submitted to county and town staff are to facilitate a residential subdivision comprising of 582 residential units. That's further broken down into 243 single detached dwellings, as well as 339 townhouse units. And there are various other elements of the draft plan of subdivision that are being facilitated through these applications, which Heather noted being parkland, stormwater management infrastructure, natural heritage systems, and a public road network to service these lands. I'll note, as part of the review process, we've been working with staff on delineating the natural heritage system and defining those development limits. We've had some very productive discussion with county staff, town staff, and their peer review consultant, and we think we've identified the appropriate development limits while preserving that natural heritage system. We've also been working with county staff on a functional design on the infrastructure that will be required to service these lands. As part of that infrastructure design, we will be delivering from Hamilton Road water and sanitary services that will extend through the proposed development that will extend through the proposed development south towards Thompson Street to service future industrial land. So not only is this application facilitating that important residential growth in the county and the surrounding context, it is going to facilitate infrastructure to deliver future employment lands in the future. And I'll note that Cache has been working with county staff on delivering that infrastructure and is certainly committed to working with county staff to deliver that infrastructure as part of their future phases. Our first phase of development is should council proceed with the proposal. I'll note that we have been working with staff on a noise constraint as it relates to the rail line that abuts the property to the south. And as part of this process, Cache will be seeking a Class 4 designation for a portion of the lands on the south limit, a portion of the south limit of the lands. And those who are not familiar with a Class 4 designation, that is a land use planning tool that municipalities have in their toolbox to, under the Ontario Environmental Noise Guidelines, or the MPC 300 guidelines to be specific, that allows a municipality to approve development with some higher, slightly higher nighttime and daytime noise limits as a result of nearby industries. In this case, we're referring to the rail line to the south. As part of that noise, that Class 4 designation, there will be a requirement for some on-site noise mitigation measures. In the context of this proposal, we would be looking to upgrade, for those lots that we would be seeking that Class 4 designation, upgrade building materials and window standards, as well as facilitate a berm and a noise wall on the south, on a partial limits of the south limits of the plan, and that noise wall would reach a height of about approximately 2.4 meters. Additionally, we'd also be implementing certain warning clauses as part of any future purchase and sale agreement to just identify that, exceed that Class 4 designation in the nearby industry to the south of the proposal. And I'll just quickly stay on this slide for a little longer and just speak to some of the concerns that I noted in the submissions that were appendix to Ms. St. Clair's report. And I did note that there was a concern raised with the minimum zoning standards that are being proposed as part of this application. And I'll just, as a starting point, Cache Homes has had a lot of success in delivering this particular product in nearby and other municipalities. So from a starting point, we know the typical minimum standards that are required to facilitate an efficient and effective family-oriented housing product as part of that subsequent building permit process. So we had filed our application with those minimum standards as a baseline because we know what certainly works as part of that building permit process. We did Ms. St. Clair did go into this, but we did hear concerns about traffic management and that single access that we have designed for the subdivision onto Hamilton Road. And I'll note, and Ms. St. Clair did note this, that as part of this, what's not depicted on the draft plan, but would be part of that subsequent detailed design process to support plan registration, is the implementation of an emergency access block onto Hamilton Road from that Street P, which runs parallel for a segment of the proposal next to Hamilton Road. So there would be that expectation as part of the conditions of approval to implement that, or design and implement for that emergency access block. We did hear concerns about, or did read concerns about parking, and I'll just note as part of this application, we're not seeking any amendments to the town's minimum parking standards as it relates to this residential development. We did hear concerns about stormwater management, and again, as part of that subsequent detailed design exercise to support plan registration, Cache Homes would have to undertake a functional design of the stormwater management infrastructure as well as the stormwater management block and demonstrate to county staff that we are controlling all our flows on site to not create any additional, stormwater management concerns with neighboring properties. That would be an expectation as part of that detailed design process and be required prior to any engineering approvals. As part of my next few slides, I did put them in the presentation just to identify some of those minimum standards that we will be seeking as part of this application. And I'm happy to speak to any of those specific standards, but I won't go through each and every one tonight or right now. And then I always like to include in my slide deck just some conceptual renderings of what to give a sense of the look and feel for what these houses could materialize as. These are renderings that I had borrowed from another cachet project. I believe this is their Woodstock project. But that's sort of the general vibe or feeling that we're trying to capture with this application. And through you, Mr. Mayor, those conclude my submissions.
Thank you very much. I'll ask that you don't go far in case there is any questions that you're able to answer this evening. I will now open the meeting for comments from the public. This portion of the meeting provides the opportunity of individuals to speak to the application and have their comments considered by the planner and council before a report and recommendation on the requested zoning amendment is brought forward for a decision at a subsequent council meeting. Any member of the audience, so just to be clear, we will not be making a decision tonight. The comments will be put together and then be considered by the planning staff as part of the application. That is something we do differently here in the town of Ingersoll to allow for those comments to be heard. We don't make a decision the same night. We want to make sure we have that feedback and it's considered. Any person from the audience who wishes to provide comments in support or opposition of the application may do so now by coming forward to the lectern and stating their name and address for the public record. Is there anybody from the public who would like to speak to the application? Yep. I appreciate everybody else wanting everybody else to have a turn, so we'll get to we'll make sure that everybody who wants to has a turn. So.
My name's Terry Harrison. I live out Hamilton Road. I actually own the agricultural land to the west of this proposed subdivision. Anything else you'd like to know about that?
Just your address, sir, for the record.
583-428 Hamilton Road.
Thank you very much, sir. Continue.
Okay. I'd like to draw the council's attention to the secondary plan that was circulated in January of 2024. In that is quite clearly the page 45, map 2, which designates this particular parcel of land as well as the rest of the annexed area as to what is supposed to be there. It outlines it very clearly that there is only along Hamilton Road room for the townhouses. So what happened? What is being presented is not even close. The increase from low density to medium or high density, in my estimation of 339 townhouses, is overkill for this piece of property. Also, there's many other things that I've already submitted to other reports to you people, one today and one on September the 3rd, outlining my concerns. We have a situation that is hazardous along Hamilton Road, which is the 401 bypass, and you have all of this traffic, which at certain times of the day is going to try and enter onto Hamilton Road. Why can't we have incorporated in this, an exit onto Thomas Road, a second entrance? Why? It's there. Yeah, you've got things to overcome like the railway, but it's there. The other issues we have, excuse me, I did put my glasses on here. That happens sometimes. Yeah, only one entrance. School buses, okay? We have to think of that down the road. If you're going to have a subdivision, you're going to have kids. Where are they going to go to school? There's no school in the area, so they're not walking. So this will mean at least a minimum of 4 school buses, if not 8 school buses, twice a day. They can't stop on Hamilton Road. 1 or 2 do right now, but not 8. So, there's got to be accommodation within the subdivision to be able to handle this. Where are they going to park? With this high density It's just not going to work. In a larger community like Toronto, you can do it, but not here. Garbage collection has the same problem. Mailbox delivery has the same problem. You know, we're doing away with the door-to-door postal delivery system, so where are you going to have this mail? You're going to have to take one of those lots at each end of the subdivision and make them into a mail or a garbage depot. I want to see trees as part of, again, the secondary plan. Trees are supposed to be, I see nothing in here that supports that in this presentation. Land grading on the west side, in particular, because of the grade of the hill along this westerly portion, is going to be a significant issue for the developer. I want to make sure that there is a grading system that's not going to cause erosion. The secondary plan, page 12, item 3.2.33, indicates no residential within 300 meters of a rail line. 300 meters, virtually 1,000 feet for those who aren't my age. Okay? So what do we have here? If you look at what's proposed, 1,000 feet, it'd be halfway down the subdivision that's there now, the land. So there's just way too many things. And if you were to really take a minute to look at page 45 of your secondary plan, you would see that the bulk of the building, which includes only one parcel as being townhouses, was intended. And you people were all here. So I just ask you to follow your own recommendations. I think my two reports kind of stand for themselves. If you will take the time to read them, I'd appreciate it. Thank you.
Thank you very much. Next person who would like to speak to the application.
Tom Mayberry, 337 Thames Street South. One very brief thing. It has to do with the Block 307 woodlot. Is that going to be park? And if so, there's no access. I'm used to living up by Caffin Street. To get in that woods, there's 2 or 3 accesses on each side. And that's a lot smaller area than this. So you've got all those people, and if they're thinking they're use that for park and there's no access to the woods, because that's the residents all the way along. Anyway, that's my only comment. Partly what's the land use expectation?
Is staff able to answer that
for park
question this evening? Or we can certainly get an answer, but they may be, I don't know if there's an answer this evening. Yes, Heather's saying she can't answer that, so.
Through you, your worship, to the question. It is intended that Block 307, the woodlands would be retained by the developer under private ownership.
with the expectation it will be used
As private property. They will remain as woodlands, but as private property.
So all the park space is those, is the small ones that are there. That's not considered for use by any of the people living in this proposed development. That's very helpful. Thank you.
Okay.
Hello, everyone. Darrell Hall, 438 King Street West. Thank you, members of the council, for hosting the event tonight, and to our local residents for sharing many of our shared concerns. I want to start off by saying I'm not speaking on behalf of the residents, I'm speaking on behalf of myself, and that my belief is that residential growth is important to our community. But I have some very specific questions that perhaps we could get some answers tonight, and if not, perhaps council could direct staff to come back. Specific to the traffic flow analysis, I think in our first public forum or presentation, we had asked that information be made available. If it has been made available, can we clarify where it is? And if it isn't available, when can we expect the traffic flow analysis to be made available? That's sort of one question.
Okay. Heather, can you provide any information on that this evening, or?
Yes, just for clarification, you're looking for the traffic impact statement?
Sure.
Yeah, okay. That's always available, that information's always available by contacting our office. At this point, the applicant has submitted 3 versions of that study. So the original study, as well as 2 updates, both of which have been peer-reviewed by the county and the town's consultant. And I'd be happy to set up a time to go over that information with you, and we can forward it as well.
I think it would be important, rather than having individual meetings, that it's made available to the residents. It's a public document, so it should be shared publicly. Question number 2. And more specifically, again, to members of council, we're potentially adding upwards of 3,000 new residents in this new build. What percentage, or in terms of the long-term plan for social services and social safety nets, infrastructure builds for childcare, seniors? I know we're all hearing about the rec center. That has nothing to do with the social safety net that I'm talking about. So what part of this plan can you share with our group that is identifying how we're going to take care of these people?
So I don't think that's something we'd be able to answer as a council tonight. That's part of getting the feedback from the agencies that will be looking at this. Again, it's circulated a number of agencies, and Heather can expand on that, exactly what that looks like, but that's why they have the planning proposal come forward, and so it can be evaluated from a number of different areas. Some of those agencies are outside of our control as well, but it's all part of the process. Maybe, Heather, can you give a synopsis of the circulation that happens, please?
Yes. Essentially what I can provide is that Oxford County Planning consistently updates their forecasting and growth projections, and we circulate these applications to all public agencies that would be considered to have an interest in the proposal. That includes Southwestern Public Health, the local school boards, police, fire, ambulance. So all of those agencies would have an indicator that these units are coming down the pipe, and we expect that they plan for those increases to growth accordingly.
I would encourage members of council to ask some additional questions about this. We've all heard of stories around Woodstock and Tillsonburg and some of the other communities that have had similar residential developments placed, and that the social services significantly lag, upwards of 10 years. So again, if you are going to expand the build well past the 200 units or so that was originally put to you, I would be asking members of staff, how are we going to take care of these people on day 1, not in year 10? We've all talked a little bit about access points. So I would ask council to ask staff what best practice they have reviewed in terms of a residential development that sits on a major artery that also only has one point of access. And have they considered other options, or is that the only option that has been presented to council? I think we would all share that that seems unreasonable when you're theoretically going to be adding upwards of 3,000 cars in a daily commute between sort of 6 a.m. to 9 a.m. through 4 p.m. through 7 p.m. Having that many vehicles enter in one point doesn't seem reasonable.
Just to touch on your comment, we have the same information as the public has. So this is the only application that we received on this property. So that would be the option that is presented here tonight. But I do hear, and there's been a number of comments, and concerns shared about traffic, so
I'd
that is.
be asking that as a counselor. You've got 3,000 cars that potentially could be turning left into the new development. And what would that look like, especially when we have another easily convertible access point on the south side of the property? My last sort of question to council, really, versus staff is, we all understand the need for residential growth, and what percentage of the proposed residential development has been earmarked for affordable housing? We've talked a lot provincially and through the municipality around the need for affordable housing. So perhaps the developer today could share what percentage of this new development is earmarked for affordable housing. Can you answer?
I will ask through the planner, is any of the portion at this point marked as affordable housing?
At this point, we have had those discussions with the developer, but they have not indicated that any will be affordable.
So those are really my questions. I know that residents will have more. It is concerning to me that the original plan has been increased threefold, that the infrastructure and the community supports have not been thought about in day one. The impact for traffic has not been identified. I would encourage council to drive through the similar developments that have been shown, to see the traffic density, the parking issues, the snow removal. We're talking about 1.5 meters between houses. You can't put snow in 1.5 meters. You can't park 2 cars in 6 meters. So where are these cars going to go? These are the questions that I think you should be asking staff and the developer. Again, my view is development is good. We need more housing, but it has to be a very thoughtful and well-planned plan that has not been changed 3 times in the matter of a year without significant residential or residents' input. Thank you.
Thank you. And just to clarify, council will be able to ask questions after. We ask questions after the public, so make sure everybody can have their say. But I'm sure council will have their full opportunity. Anybody else who'd like to speak to the application, please come forward.
You wouldn't be able to sit down through this.
Dave Alch, 583564 Hamilton Road. A couple little comments. Just wondering, how many cars or how many houses per acre did you have on that? I had it, but I didn't bring the number with me.
The density that's being proposed is 40 units per hectare, or 16 units per acre, and there would be a total of 582 units.
16 per acre.
That's right, yeah.
Okay, so our lot's just under 3/4 of an acre, and I stood in the backyard and I looked. Like, how in the God are we going to put 12 houses on that piece of property to make it work? And if you have 14 feet of grass in the front, we don't have a big car, but it's 16.5 feet. My pickup's probably 20 some feet. Where are you going to put this stuff? How are you going to make this work? Just a couple comments.
Hi, Ed Rooney, 467 King Street West. I'd like to know how this contractor can guarantee that the houses that are there now are not going to get overwhelmed with water. because this is wetlands that he's building in to begin with. We live on the east side. The land slopes down to the east, at least my property does. There's been development done in the back, a lot, right behind us, which affects us. How can he guarantee that it will not affect us? I've had the town there, I've had the county there, I've had Upper Thames there. I want to know how he can guarantee that we are not going to get saturated.
There are a number of studies that the applicant is required to do. They are fully available, that they're required to do and meet conditions in the design process that it was stated. So absolutely, that is a basic principle of land, is that you're not allowed to put water on other people's land and for drainage. So, but those comments will be noted and they can be addressed in the planning report. Welcome back.
Sorry, I forgot something.
Absolutely.
Okay. Anyway, I drove into the one in Woodstock that they have. It's been going a few years now. There's probably 6, 8 houses in there. I don't know whether anybody lives in any of them yet. At Tilsonburg, North Street, quarter, there's a whole subdivision in there going, 4 houses in there. Weeds growing all over. Go down Isuri Road into Thorndale. There's a big subdivision there close to London. Street lights are in. Weeds are this tall, not a house in there. I thought I was going to take some pictures and show a nice cornfield versus a nice field of weeds. And just to point, a little point. Do we need this going right now? Thanks.
Would anybody else like to speak towards the application?
Good evening, Your Worship, members of council, staff, and all attendees. My name is James Harris, and born and raised here in Ingersoll. Currently live on 21 Shelton Drive. And thank you for the opportunity to speak here tonight. I'm not really here tonight to speak in favor or against. I might have some negativity from both the public and the owner, so give me a 5 or 10 second head start before everybody runs after me. My questions are more to get a better understanding of how this new development is only low and medium density housing and seems to not have a requirement. Maybe this kind of project specifically and in general, how new subdivisions and developments do not have a requirement for any high density buildings. I received a notice in the mail a month or so ago regarding 2 6-story apartment buildings that will be squeezed into a parcel of land on North Town Line. This is the old garden center nursery that's recently closed. I know we're not here to speak about that today, but upon looking into this new plan on North Town Line, speaking to the planner, and it was advised that high-density buildings have been built previously in Ingersoll and continue to be a high priority for the town. With that being said, when I saw the plan and report for this subdivision we're talking about tonight, I was just very surprised to see it was only medium and low density residential homes. As described above, we're seeing high density developments being placed into long established neighborhoods that were never designed to handle that level of traffic, parking, or infrastructure demand. At the same time, new subdivisions are being planned for and in the approval processes without meaningful requirement for high density housing. Why is high density not being built in new growth areas from the start, where roads, services, and amenities can be placed to accommodate? Instead, established neighborhoods are being asked to absorb developments that can create significant strain and alter the character of the existing neighborhood. We have opportunities in new subdivisions for potential buyers to review the plans and choose to move into an area with high density, not put this burden onto your current Ingersoll residents. In conclusion, I'd like to understand just the reasoning behind this approach and whether there is a plan to ensure all new developments include their share of high density and not just putting all this onto the existing kind of homeowners in your town already.
So certainly I'll turn it over to the planners, but it was mentioned earlier, the secondary plan process that was identified for these lands, identified what type of uses they were. It's a public process to identify the type of uses that would be suitable for this land when that was done, and medium density and low density was the ones that were identified for there. So there was no high density. That being said, owners of land are allowed to make applications, so that could have been an option for this landowner to make an application for high density. That isn't the case. As council, we have to consider the application that is, it is presented towards us, as is the same as other applications within the town of Ingersoll. We set planning, what we like to see on the property, but private properties are allowed to, there is that, the ability to put forward applications, and those be looked at on their own merits, but in this case, this area was not identified in the secondary plan for high-density housing. I don't know if that had any indication on that, but there's a very amounts of reasons why that is, and it was a public process to be able to do that. Heather, do you have anything to add to that?
No, nothing further, thank you.
Okay. Hopefully that helps out.
Okay, thank you, so.
Yep.
Dennis Cosgrove, I live on Kirk Crescent. Have any of these traffic studies been considered for 600 possible new houses, 2 new apartment buildings on North Town Line, a 5-story apartment building going on Bell Street? There's really 2 or 3 roads into London, 1 or 2 roads into Woodstock. We're going to almost increase our population by 30% in a very short period of time. Has that been considered?
Heather, please.
Through your worship, I'm not sure I fully understand the question. Is it possible for you to rephrase that?
If I could
582
provide
houses.
so clarity, I think the question is when does traffic studies come into play for certain developments?
So traffic studies are provided for all developments of this scale. In this instance, the study area largely included the subject lands, so the intersection at the proposed Street A and Hamilton Road, as well as the intersection of Ingersoll Street and King Street West. So that was the majority of the study area. I believe the applicant's traffic consultant engineer is here tonight. She might be in a better position to speak to that question.
And then in other areas, there's been other applications, there is obviously a single house, but if there's a different type of planning that's being proposed, is when do the traffic studies kick in, I think, is that?
Yeah, do they all work together, or are they all individual based on what works for the contractors?
It largely depends on the scenario. In this, typically the traffic studies that we receive from the applicants are largely guided by the individual application, but they are reviewed from a county and town perspective as a whole.
Okay. Can I ask a question through you, sir? All your consultants, Cachet Homes, did they not tell you spelled their city wrong on your slideshow?
Sorry, you can't.
They spelled Ingersoll with 1 L. All the studies, all the consultants didn't clarify that they spelled their city wrong. Thank you. Have a good night.
I don't know if you've seen, like, when the 401 shuts down, 467 King Street West. When the 401 shuts down, Hamilton Road is truck to truck to truck to truck to truck. How do we get, I can't even get out of my laneway half the time. How are this subdivision going to get out of their road? Is this more traffic? 3,000 more people? 3,000 more cars when the 401 shuts down? So there's been no studies ever done on the Hamilton Road?
So yes, there has been, as the planner stated, the traffic impact study is a part of this, which considers the background. So there is a number of studies that the applicant is required to have as part of this application, so it can be considered and evaluated.
Because, like, I'm telling you, like, that road, it gets bad.
So your concern would be traffic impacts?
Yes.
Absolutely.
I'm
Okay,
concerned with a lot of things actually up there.
No, I'm just trying to clarify so that we can make sure that we can address those concerns.
You know, like things are never ever looked at here in this town. I've noticed that. It's just push through, push through, push through. Nobody ever talks to us.
one point that I wanted to bring up. See, I left some papers here. I just have one further point. There was a mention before that there was some second parkland. The parkland on this proposal is on the extreme south end, lined across the railway or Thomas Street. Somebody had mentioned that there was a second piece along the north side. Is that supposed to be the stormwater management? Is that what's going to be the second park? It's beside the what? Beside the pond. That little park.
Sorry, just there, that is the, there's two.
You can't get two cars in there. So the idea here is that with this plan, the playground for the kids is the street. It's going to be roadway and street for parkland? I'm asking a question.
So I don't see any parkland dedicated in the roadway, sir. There are two blocks.
I don't either. I'm being sarcastic, excuse me.
Oh, I know you are, sir. It's not appreciated.
But there's no parkland designated for the north side.
So
the kids are going to come all the way from the south, or from the north to the south.
So I'll be very honest. We are having this public meeting so we can hear the serious concerns. They will be taken into consideration. So everybody needs to come here and give those concerns so we can take them into consideration. And to have it done sarcastically, like they won't be taken into consideration, is one of those things where, you know, this is what this process is for. So everybody can come and say and have their piece, whether they like it or not. That's what it's for, so we can address these concerns and make a good decision.
And
we need the feedback, and we
come across a little brass.
well, and we welcome the feedback, and so I don't know why there's no need to be brass, because council welcomes the feedback. People who live in the area of development are true experts of that area more than just the everyday person who lives in Ingersoll, because you have more of an area in there. So we need that feedback. So there's no need to be brass. There's no need to be sarcastic. We need true feedback so we can evaluate this, so we can get the best outcome for all residents in Ingersoll. So that's what I asked for.
I will use an example when I was driving around up where Clark Road, where off of the behind where the Food Basics is. There's a, yes, okay. There's a subdivision there. When I drive through there, the only place I see kids playing is in the street. They got no other place to go. You're going to end up with the same thing here. That's all I'm saying.
I appreciate that comment.
I promise I'll be quick, sorry. And I think everybody breathe. It's been a long process, right? Let's make sure that we show respect to our representatives, because they are, hopefully, and I'm sure they are, acting in our best interest. I just want to point of clarification. In terms of the developmental charges that existing residents will have to pay when this residential build is complete, did I hear right that the park that's within the proposed development would not be available to the residents who paid their share of the developmental cost to build the water lines to that place?
So my interpretation of what was said, and I can be corrected if wrong, is that the parkland, there's parkland, and then there's a private woodlot. The private woodlot is not park space, and so it would not be treated as park space. But there is park space that would be turned over to the town of Ingersoll and be treated like any other park within the town.
Great. And just one last question for me. We've talked a lot about the other artery that is south of the proposed development, and our questionings as to why that street hasn't been designated another artery that could support some of the traffic flow. I'm not sure we've received sort of a detailed answer as to why. We don't have to build the infrastructure, the water, and all of that stuff, but why is that street that's already there that could access both Culloden and 73 not being considered as another artery?
Is there anybody who would like to provide an answer this evening, or we can try to get an answer back for you? The one that first comes to mind to me is that this property does not own property all the way to Thomas Street. The property on this application ends at the railway.
So there's another owner in between?
I believe, but according to this map, I believe so. Unless the applicant owns that other land, I'm not sure, but we can certainly get information on that.
Perhaps there's a way to make an easement if it isn't owned by the same developer?
So duly noted, and we'll make sure that we get an answer for you on that one. Would anybody?
So you didn't answer his other question there about the cost of the people that already live there. We're accumulating the cost for everything, and the new owners don't?
No, that's not, I don't.
Is that not what you just asked?
No. So the developer will be responsible for all the infrastructure within that parcel, and then including the roads, the sewers, the water, if anything, and that will be turned over as assets to the municipality. Other charges, there'll be development charges on properties that, if it were to go ahead, there's development charges that pay for growth aspects of different aspects of it.
But I know our costs are extremely high.
Yeah, so.
For ours.
That's as much as I can get into. There wasn't a true question there. There was more of a statement, and it transferred into a question, which I believe was answered or going to be answered, so.
Yeah. Are you having another meeting again? Or?
So after this public meeting, the application will be brought back at a future meeting, which has not been scheduled yet. Once all the information has been considered, the planning staff will make a recommendation, and then council will consider that information to make a decision. But yes, there will be a future meeting, which will be a public meeting as well, in the round that.
You're just not going to decide.
Not behind closed doors. It'll be much like this evening.
Seems like a lot.
But this is the.
Without everybody knowing, that's the thing. So.
Yeah.
I'm sorry, yes.
Would anybody else like to speak towards the application?
Pays to show up sometimes. Tim Lobson, 65 King Street West, Ingersoll. The mayor, in his opening explaining public meetings, he said that Ingersoll does public meetings differently, and they do. This will be the only one that you guys can come at without asking for delegation status. You'll have to get notice. You'll have to watch their meetings on Thursday when the minutes come out to say that there's actually going to be a meeting on this. And then you request delegation status to say, I would like to speak at the meeting. And when all of this stuff is considered, it actually goes behind closed doors, it goes to staff, and then when it comes back, plan has something to show council that they will.
Sir, do you have any comments toward the application?
Yes, this is a comment towards the application.
Okay.
Explaining the process. Planning will give council what they say a recommended solution to all the work that they've done. And there's a lot of work. There's a lot of work. Do you guys see all the stuff that's already been going on? And then what we've seen time and time again is that council will say, well, we can't turn down a planning recommendation because it's going to be very expensive. So that's why it's important that everybody has their times. They will calculate all their stuff into that, but whether the decisions are made to the advantage of the residents are a little strange. And this is something that happens all the time. Single access, most of this council will be well aware of Oxford Village, 240 units, single thing. There was a meeting up here in council where they were saying about emergency access. I think it was a week later, there was an emergency right on the first road to the right-hand side, which partially blocked off Owen Street. Cars had to go around the emergency vehicles. It was only for half an hour or so, but still. Walker Road's up. That's a 20-year development. 20 years it took to get that second thing. In the consultant or whatever he is, the representative for Cachet Homes, they build nice houses. I was checking their stuff out. They have, on the slide they didn't show, They have 2 other different plans for that property, which have different access and everything else. They didn't put them up there, which is curious, but none of those plans show 2 other roads going to private land in southwest Oxford, which would require a boundary adjustment again in order to do that, because we can't service over top of other things. So we're being fed selective information, almost. When the notice come out, it didn't show all the streets and all that other stuff that's there. And to me, that's the most important part.
What notice are you referring to, sir?
The notice of the public meeting.
So the,
When it first came out, after I complained, all of a sudden, the thing came out.
so this application has followed the same process and the same information is provided on every other application. There's a complete application notice, and then once the council agenda comes out, we get the same information at the same time as the public, and this information is presented at a public meeting for everybody to see. The same information that we have access to, everybody else has access to.
That's not what I was told by the planner, so that's okay. I was told that you all had detailed information on the thing, so that's okay. Anyways, I'll go back down to the nitty-gritty of it. Am I right about this being the only public meeting? Unless you guys decide otherwise? All council meetings are public, so.
So this is a public planning meeting under the Planning Act.
Right.
There's also another one at the county for the official plan, which will be a public meeting for the official plan aspect of it. But you are right that when this application comes back, people are free to ask for delegation status to speak to it, and there's a process for that. If anybody's interested, certainly contact our clerk and they
And
can
we're
provide.
the only municipality in Oxford that does that.
No, because we have our public meeting beforehand.
You have a public meeting, but nobody ever does, it doesn't really matter. You're not going to change the way you control the information anyways. We had public meeting, public process for the secondary planning, right? Secondary plan, which was published and out there, does not, even in the report, this development does not coincide with the secondary plan. So public was involved with that, not very many, I'll guarantee you that, but we have a public process that says, hey, this is what we can fit in here, and we're just gonna blow it out the door, right? We also have had the previous council did a complete streets. They said that any major development, we're gonna do complete streets, which provides for active transportation routes. Wednesday, council, it's been delayed, Wednesday, county council is gonna go and decide whether they're gonna proceed or what the timeline will be for King Street reconstruction. And I think it's almost a year of construction. You know, and it's supposed to be done at the end of 2026. We're gonna take a break for the winter, probably be 2027 now, I don't know. And it's only $12 million, that's a deal for what they're putting in there. Because if you look at the lay of the land, anybody that's ever ridden a bicycle or walked along there, that's sort of a crappy place to build a road, so. But, hey, you got a good deal. But we're ignoring active transportation. So are we gonna put in a sidewalk there, or are we gonna put in a paved thing like we've got up on Pemberton Street, where you've got roads, or in front of Cami? Because that makes more sense. So at least if this gets built, people that wanna walk, or people that wanna do things, and you were on the committee when we did that, you know? So that's something to think about. So if this is a go, something we learned from the planner is that they're going to be putting the sewage in for the industrial developments in behind. So they're going to go underneath that railroad. Well, not them, whoever's going to hook it back up again, eh? So that sort of puts things in perspective, perhaps, about why the rush to get that land in. Employment lands are expensive, or things. So, I mean, those are your decisions. But what's this? Yeah, they mentioned about sidewalks and parking. You can drive around in your neighborhood. You can see the townhouses there, and you can see the pickup trucks that go over top of the sidewalks that are there. Because they have a parking spot, but their truck goes over top of that. And when you complain, they say, well, bylaw has to look after it. So we got to quit making more work for bylaw people, right? You know, we only have, I think it's a 20 meter, it's a standard road, but there's gonna be no on-street parking, or if there is, and in roadways that's that tight, like you got 18-foot wide townhouses. You can't park a pickup truck in front of them. You're gonna block their driveway. And then you've got kids coming in and out. The beautiful woods there, you won't be able to access it from the south part because there's gonna be a stormwater management pond with a fence. And I thought, well, but they can just go around the back. But no, there's a noise attenuation wall that's across the back. So that property is completely blocked off from anybody unless you want to risk going across railroad tracks. You know, so we're wasting a green space here, the active part for that. I know you're going to cut me off for time, but.
No, to answer that question, that is privately owned space, and that's the intent to keep it privately owned. So it's not
They're
intended
the ones
to
that are
be.
building the houses in front of it, so they can take one house out. Let's make a trail. I mean, really. And why, I don't know why they would want, I hope we charge lots of taxes for that property. I don't know why you'd want to keep it, really don't. Unless the town doesn't want it.
Sorry, if you'd like to,
Yeah, I just want to make a clarification with respect to the woodlot. So the woodlot is not actually the cache's ownership.
sorry, if you could, just because we are broadcast, can you just come up to the microphone just so we can, in other words, when it's still going on YouTube, we can't hear the responses.
I got my shot.
All right, no problem. Thank you, Mr. Mayor. Marcus Gagliardi with Cache Homes. I won't take up too much time. I just want to make a point of clarification for the woodlot. The woodlot is not going to remain in Cache's ownership. We purchased the property from the Pye family. The Pye family is actually going to retain ownership of the woodlot after the plan is registered, approved, and so on down the road. We have had conversations with staff, and I think with some of your upper management as well. We're happy to work with your staff and the Pye family, for that matter, to try and secure a lease or an easement through the woodlot that would be accessible to the public. But if it's not in our ownership, we can't necessarily grant it. If it was, we would grant it to the township. But we're happy to keep working with staff, working with the Pye family. If there's a lease or easement that we could work out, we're happy to do it. We do believe it should be accessible, just unfortunately, the ownership doesn't allow us to do it. Okay. Sorry.
Awesome, thank you. The stuff you find out at public meetings. Socks, public suggestion. Plan parking, public notice. Yeah, I think I've done it. These guys, oh, and thank you for explaining class 4, because I ruined my Google just trying to figure that out. But there's a lot of class 4 things out there, but that makes a lot of sense. So thank you, welcome to Ingersoll, and hopefully these guys can find a way. Oh, I got one question. I have one more question, which is pertaining to this process. Planning is recommending that you just receive it as information, which is really a non-answer, right? Okay. What happens if you say, no, you know what, we're not going to receive it as answer. We want you to go back. These guys have all the questions that we raised. Go back. You guys try and deal with the problems that have been raised. Planning through traffic and all that other stuff is just say, you know what, this was a bad presentation. We should really have done better. We should have known more stuff. And I look at how the golf course people did their process. They stepped outside of you guys. They engaged with the public. They made that a community project. They also found they can make money playing with a golf course, so everybody over there is right. But I mean, I'm just curious, what would happen if you just said, you know what, this is unacceptable. We're going to send it back.
Well, at this point, we don't have enough information to know whether it is acceptable or not, but that is part of the process of having the public meeting and getting the feedback. It allows those conversations to take place with staff, the developer. They can hear the feedback from the public and make, if they feel that they can make some changes to accommodate that. That's the process of having that time to be able to do it.
You know, I answered my question is if, when they ask for this to be received as information, and a majority of council says, no, we're not receiving this as information, what happens? Does this go back to the drawing board?
And the applicant could go to through the Planning Act to the OLT. We get no input.
Why not? Why can't you do that? You always have that threat.
Because the Planning Act says so.
Says what?
Planning Act says they can.
So whenever they bring something in, that we just have to approve it?
No, so when there's an application put before council, there's a timeline that starts. If council does not make a decision within a certain timeline, that gives the applicant a right to be able to go toward the OLT and have an appeal. It's happened before. It makes sure that planning applications are dealt with in a speedy time, which is provincial want at this time, to be able to make sure that applications are made their decision and that we're dealing with them to make sure that there's not a backlog. We don't have a lot of those same issues that, say, the GTA has, with a lot of applications and backlog. It can take a long time for things to get through. Certainly, but this process, we're within the timelines to be able to do what we're doing, to have that time to go back and have that feedback. But we are responsible for making a decision in a time frame, and if we don't, all of the feedback doesn't matter, because when it goes to the OLT makes a decision, and that's it. We have to abide by it.
So receiving for information, if you reject this, it's just like rejecting the whole thing, basically, what you're saying.
Well, at this point, it's going to come back anyway at a future product, because that's our process. But if we don't receive it for information, we just don't receive the presentation for information. It's just not in the record.
Huh, that's interesting. Okay, no, I was just curious.
I just got one last thing that I just want to bring to your attention.
Yeah. And I do want to hear from everybody, but the only thing I ask is that we do have we have some people waiting in the audience as well for some other stuff. So if it's been said, I can guarantee you it will be looked at by staff for questions. So I just don't want to repeat anything, so that in the name of every time.
On the county map, we were talking a little bit about road allowance onto Thomas Street, and that it was owned by somebody else, which is the railway. But on the county map, there is, or has been for years, an allowance, a road allowance for Wallace line to travel right through that particular piece of land. So I'm just curious as to why that couldn't still be implemented. It is a road allowance, it has been a road allowance for all my life, just never exercised. So it's just food for thought.
Okay. Any further comments from the public on the application? Seeing none, I do want to thank everybody for participating. This is what it's about. This is why we have this, so we can get the feedback, and we do take it. I can guarantee you that council and staff do take into consideration. That's why we have this process, and we're not making a decision today. Members of council now have the opportunity. Members of council now have the opportunity to ask any questions about the application. However, they may not offer any comments at this time. Just explain that. We can certainly ask questions, but again, we don't have something to make a decision for us. We're not going to be biased. We got to form an opinion based off all the information. So, questions from council on the application. Councillor Halleru, please.
Thank you, through you. So, question to the developer. Most times when we get these presentations, we hear often that we've done these kinds of builds in different communities, and there seems to be an expectation that because it has happened in other municipalities, that it can happen here. Now, one of the things that we have as a problem is we don't have a transportation system. And you've heard very dearly how people are really concerned about traffic and concerned about the issues. So the question I have is, looking at the plan, I'm also worried about, measurements of lawns for parking, access roads, and so many things have been said. So would you be willing to consider redrawing your plan to take into consideration some of the things you've heard and resubmit an application that sensibly kind of respects most of our bylaws? Because there is a lot, and I have a specific question when it comes to the, I was just looking up this. No, there's a 72, I just mistakenly closed it now. Where is that? Give me a minute, okay? Where did it go? Okay, I think I misclosed it here, okay. All right, so when you talk about I just have a question on that little page where you have the measurements. You say there's no change proposed or removing provision not applicable for gross floor area minimums. So are you saying there is no minimum for a building? Like I'm seeing 807 square feet for the minimum required as our bylaw requires it, but you're having removing provision not applicable. I don't understand that. I don't know if Heather can explain that or the builder.
Oh, I see what you're looking at. Through you, Mayor, to the councillor. The provision that you're speaking to is to establish that, again, a minimum gross floor area. We're not proposing any changes to that because through the bylaw, we will be establishing a maximum lot coverage, which in turn would establish a gross floor area for that ground floor development. So it's sort of a zoning nuance kind of and how they work with each other. But because we are establishing a maximum lot coverage, we would in turn be establishing or exceeding that minimum requirement anyways, as part of any lot development on the site.
Okay.
And to your first point, certainly we're going to take the feedback we receive here today. We're going to group huddle with our team. We'll sit down with county staff, their peer reviews, town staff to understand if there are changes to the plan that need to be considered. We are considering them. Maybe I can't guarantee the comments we received today will facilitate changes, but perhaps it may facilitate some additional information or how we synthesize our materials in our technical studies to help clarify or to better explain why a certain thing has been done as part of the application. So we'll certainly take that feedback as part of our next steps.
Follow-up question. So the follow-up I have is when you talk about the traffic study, I'm not sure if this is you or Heather, we're doing the traffic study now before those 3,000 homes come in. Is there a result that is going to be predictable from the traffic studies that you're having now? And if that road is actually being expanded to accommodate for this increase? That's to Heather and that's to you. First question is to you, and Heather will answer if King Street to Hamilton Street expansion will actually accommodate for future density.
And through you, Mayor, I'm just going to direct that to our traffic engineer, Erica Bailey.
Thanks, Mark. Sorry, Heather, were you going to speak? Okay, thank you. Through you, Mr. Mayor, thank you for your comment. Regarding the transportation impact study, so first of all, the transportation impact study is prepared in consultation with town and county staff. The first part of our process is to submit a terms of reference for their review, and it's also prepared according to the County of Oxford Transportation Impact Study guidelines. So there's a document that we follow and we do the analysis per those guidelines. And we do our base year review. We take a look at what the operations are right now with no development. So we counted traffic out here, and we have software that we model it, and it gives us operations at the intersection. So we can say the operations, the intersections are great, good, or terrible, and then we forecast into the future. So in the future, we are adding traffic. We have the general growth of the community that we add in. And then we also, through the, I hope I don't get this wrong, Southwest Ingersoll Secondary Plan, is that the document? Yes, thank you. There was a number of other developments in the area that are planned. And so we took the traffic generated by those and we added all of that to the network. And then we reevaluate what are the operations, great, good, or terrible. And then finally, we add in the traffic from this proposed development so we can see that incremental change. So we have a whole picture of the whole process of right now with nothing additional, in the future with what we call the background stuff, and then the change just based on the new development.
Are you only testing one access road, or have you considered putting two access roads even on the same Hamilton, like in and out, to reduce the traffic? Are we only basing it on access?
So our analysis reviewed, as was shown in the concept, we reviewed a single access, as was shown in the plan, and we reviewed that single access with all the traffic going out there and an emergency access. Now, the emergency access, there are requirements across different communities of when you need a second access. And so that second access is triggered. If we had 2 homes here, a second access is not required. It doesn't generate enough traffic, that kind of thing. But when you have a road, for example, that's over 250 meters long, or you have over 100 houses, you need a secondary access. If there is a collision on that new Street A, and there is, heaven forbid, a fire somewhere further in the development, the emergency response vehicles have a way of bypassing it so they can maintain their response times and get to that second emergency. So as far as the traffic operations go, because I've heard from a lot of the public about concerns over that single access, about all this traffic coming out to that single access. And we reviewed several different scenarios. We reviewed it with different levels of traffic. And given the traffic on Hamilton Road now, adding in the generalized background growth of the community, adding in all those other developments separate, the operations of that single access are still in the good range. We're not seeing terrible operations. If we were seeing terrible operations, we would have had the conversation with the developer saying, and we have, I've been writing transportation impact studies for 15 years, and we have had the case of, do we need 1, 2, or 3 accesses, or can we get all of this traffic accommodated on one access? And in this case, we found that the answer was yes. If it was no, we would have had a conversation with Cachet saying, we have to find another way to get the traffic out because this intersection is going to fall apart because it's going to be too much traffic. Is that, did I cover? Okay, thank you.
Did you do that analysis with the 401 goes down?
No, we do that.
That happens once every 2 weeks.
So,
Fair enough.
Sorry, Heather has to answer the second part of the question as to when and where the Hamilton Road expansion, if it's in the plans to accommodate future density.
Through you, Mr. Mayor, to clarify, do you mean the urbanization of Hamilton Road? I believe that that's with County Council now, and unfortunately, I don't know the timelines around that.
so right now I can say by looking at the traffic impact study that active transportation and that is looked at as far as impacts on that development. There was impacts from the traffic impact study on that issue, and that's one of the things that part of the official plan analysis I'll be asking the county about as well, about are those incorporated in that current design, or do they need to be changed? Councillor Van Kooten-Bosens.
My question was going to be a follow-up to exactly what that gentleman asked. Is there a plan then, I mean, with all the concerns that have been heard tonight, I would agree that there is an accident that happens and Hamilton Road becomes the main place for trucks to come down, everything. So is there a plan to go back and check that out? Because I can guarantee you if you tried to do it every 2 weeks, he's not wrong. There's an accident and it closes down the 401 and we have to reroute, and that is the major fairway. So my question would be, are you going to go back and look at that? Because I think that takes and plays a major factor in there.
For sure, and that specific scenario was not identified through our terms of reference review that we submitted. So I don't have analysis of that, but it's certainly something that we can take back. I've heard it here several times from yourself and from the public to review those conditions. The increase in traffic from the surrounding area, as I described, and the development, the road itself is still maintaining its intended function, but of course that's not considering all of the detour traffic in the event that the highway's closed.
Councillor Hughes, please.
Thank you. And further to these questions, what was the number of cars that you put into your computer to figure out all these numbers and the traffic impact of that new development? It's definitely not 3,000 cars.
Thank you for your question, through you, Mr. Mayor. The industry standard practice for preparing a transportation impact study is we look at the 2 busiest hours of the day. We look at the AM peak hour, usually falls between about 7 and 9, and we look at the PM peak hour, usually about between 4 and 6. We use, and stop me if I'm getting too technical here, if you need me to slow it down. There is an industry standard data set that we reference, and it gives us trip generation rates. It tells us that one single family home has this many cars leaving and coming back in that morning peak hour and in that afternoon peak hour. And what we find is that when it comes to single family homes, even though a family may own 4, 5 vehicles, 2 adults, adult children, whatever it may be, they're not all, every single one of them leaving to work at exactly the same time and coming back at the same time, certainly not on average. So when we see, Mark, 582 units in a combination of towns and singles, the, in the morning, it's about 330 vehicles, and that's combined in and out of that access, that new Street A access. And in the afternoon, it's about 450. Did that? Great.
Further questions from council? Sorry, Councilor Van Koop-Bosens.
Developer is still here, good, thank you. There has been a question about tonight, and I'm assuming you're going to come back to us with the answers, but this one did pique my interest. At this point in time, nothing has been earmarked as far as what our planner has said for affordable housing. Is that something that the developer was ever looking at in that respect?
So I'll answer that question, through you, Mayor, sorry. I'll answer that question directly, and then I'll have some commentary. So to Heather's point, there has been no affordable housing earmarked as part of this application. And affordable housing, it's interesting because the province sets sort of a standard in how affordable housing is defined, and it's based on 30% of a gross income for a family. So that establishes that baseline for affordability. We have received the comments from county staff. This is, and it's I do recognize that as part of the secondary plan process, you have earmarked sort of 10% of new development to provide for affordable housing. Further discussion with county staff are still required on how those policies will be implemented. We are the first application out of the gate within the secondary plan area. So how those policies that get applied to this particular development are still being discussed. As it relates to the affordability nature of this project, or maybe I'll use the term attainability, Cache does take into consideration their land costs, development charges, and being able to deliver a product that is competitive with the market. So maybe we won't hit that 30% mark, but we could, perhaps their marketing materials would come closer, maybe 10% below market value or 15%. That's something that's still being determined and evaluated. A lot of factors go into it, especially those land costs, development charges, and development costs. So it's early days to commit to what the market value of those units could be. And I think Marcus wants to add a little bit more details to my explanation. So perhaps for you.
Yeah, no, it's a great question, and I just wanted to say thank you to everybody for coming out this evening. I've got a few comments afterwards, but affordability is really a snapshot in time. Like the province puts an arbitrary number of 30% of gross household income on what they believe to is be considered affordable housing, but it's really a snapshot in time. A lot of the things that we're talking about this evening, even as granular as zoning setbacks on lots and lot frontages, all have an impact on affordability. If, for example, if we're going to a bigger lot frontage with a less larger lot or a less larger house, for example, the cost of land is factored into the price, right? You heard it from the planner just a few minutes ago. So we're trying to dance with all those things when we talk about affordability. We're not just trying to look at it from an income perspective or a housing perspective. We're trying to put all of that together. We haven't made a formal commitment, but we are talking about it with staff. We are talking about it with our consultants, and we'll continue to do so throughout the application. If I may, just another comment on affordability and the land and the plan that you asked about. I think it was Mr. Harrison, he's still there, made a comment about a school site. I've actually reached out to the school board, I haven't heard back. I know the school block that was proposed at Ingersoll Greens has kind of been put on hold or pause. I'd be happy to have a conversation with the school board for this particular site if they'll entertain the conversation. So just wanted to put that on the record.
Councillor Van Kouten-Bossells.
If I may, while he's standing right there, perfect person to ask this question. You brought up the lot frontage and the minimums, and I see a lot of red and things being asked to change. In my 18 years, I've seen a lot of red. And I never understand how it is. And I get it, you're here to make money as well, and I understand that. However, we put these rules and regulations into play, and I've yet to see a developer follow them. So my question would be, is it possible, and I know that it's going to take down the number of units, and I think that I'm hearing people say out there, this is a lot of units that you're putting in. And maybe if we followed some of the rules and regulations that were there, it would take down your number of units, but there wouldn't be as many concerns. And that's one of my concerns as well. So, I mean, is it possible that you're going to take and go back and look at some of this and say, okay, you know, maybe we can adjust on some of this. Yes, it might mean adjusting your number of units. It could adjust the price. I understand that as well. But is these things that you're going to look at then when you go back and look at it? Because I really do feel that this is something that needs to be looked at in that respect. And I'm hoping that we can get a commitment from you, because I want to see us, I mean, they've talked about, and I'm starting to make opinions. I'm sorry. My apologies. I don't mean to do that, but I do put that question out to you, so.
Sure. I can answer the question first. We're absolutely going to take all the comments back. I hear your comments about the zoning standards loud and clear. I don't want to look at them in a bubble or in a box. I want to look at them holistically with all the comments we've heard. Just to look at the zone standard and say, yeah, we can change all that and come back would be doing a disservice to yourselves and the community. So I want to take all the comments back, look at them holistically. If there's going to be changes, we'll come back with changes. Or if there's going to be answers, we'll come back with answers. But I don't want to look at them in a box. I want to look at them holistically with all of them, and we'll come back with responses, if that's a fair commitment.
Just a comment.
No comments.
No, sorry, question then. So,
I caught myself, you catch yourself.
are you going to take into consideration that Ingersoll prides itself in being kind of small town mix, you know, we don't want to have a barrack in our town. We want something that is, yes, affordable, yes, you know, sizable, but we don't want to have like the kind of look where everything is just a box and you can.
So this is going into a comment.
Yeah, parking. So are you going to take
You got
into
the question?
consideration the aesthetic to make sure there's enough parking, there's enough, you know, just to blend in with what we already have, is what I'm trying to say.
Yeah, and I think the answer, and I hate to use the same answer twice, but I think it's a lot of what I said with the zoning standards. We need to look at everything holistically. You've seen a lot of pretty pictures tonight. You've seen a lot of renderings. You saw a lot of lots shown on a draft plan. I just want to reassure everybody, this doesn't happen overnight. You're not going to bring 580 units or 550 units on tomorrow. It takes time. I think that one of the gentlemen brought up the example of our Woodstock development where there's only 7 houses built. You know, there's 80 sold, but there's only 6 or 7 built. It takes time. It takes time to service land. It takes time to sell lots, sell houses, market your community, and get people to buy homes. So the 580 doesn't happen overnight. That's number one. Number two is we need to take a look at the plan holistically, like you said. If it's architectural features or, you know, design guidelines that are prevalent in the town, we can absolutely look at that. With staff's help, we'd be happy to do that. So we ultimately want this to be a community that not only we're proud of, but that you're proud of, that the public can be proud of, and ultimately just want to be part of the community. So we're happy to do that.
Councillor Hughes, please.
Thank you. This is a question. Do you have a, if approved, do you have an idea of your timeline for construction?
Good question. I don't have the answer this evening, but I will say we have made a commitment to the county. I think we've made it to township as well. And I think you heard earlier on this evening that servicing through our site for the employment lands is important. So we'd want to work closely with the township and the county to make sure that can happen. If it has to happen in the first phase of our development, we want that to happen. As far as timing, I can't commit to that right now. It's still early days, but yeah. We got to sell some homes first.
Any further questions from council? I have a couple. One is that the original secondary plan envisioned a certain density for this, and it probably won't be able to answer tonight, but given the increased density, is the servicing provisions of that secondary plan sufficient to continue to service what was considered as part of the industrial development along with what's being proposed here? Again, that can be answered in the report. Also, yeah, when it comes to all the questions around traffic have been well stated, so I'll leave that there. That's my biggest concern, is that around density, is that there was plans put in place and certain assumptions that were made based off that. And so if it's not only the servicing aspect, but anything else that was a part of that secondary plan process, that was assumptions were made, this is a change to that, proposed change to that. Does that have any impact on those that infrastructure that would be required? And that's my biggest concern at this point right now that hasn't been addressed already. Any other further questions from council? Seeing none. Sorry, I did have one more, but I think you answered that in that there was, I guess the one was about the servicing going to the, you had stated earlier that it was not part of the original plan to service it through phase one?
No, it is.
It is?
Yeah,
Okay.
I think we've made that commitment to the county as well. That
Okay.
I think there's a condition, Heather can maybe speak to it, but there was a comment or condition that we received earlier on in the process that it absolutely be included in phase one. So
Okay.
we're committed to that.
Okay, thank you. With that, I will ask if there's no further comments or questions, then the public meeting for this application is now concluded. The application will now be scheduled to come before council at a subsequent meeting during which the planner's report and recommendation will be considered. As a reminder, if any of the audience wishes to be notified of a decision of council in respect of any zoning bylaw amendment, they must submit a written request to the town clerk, Danielle Richard, at danielle.richard@ingersoll.ca. The clerk must provide notice of council's decision to all those who request a copy within 15 days after the day the bylaw is passed. The Planning Act provides for an appeal to the Ontario Land Tribunal from a decision made by the town of Ingersoll within 20 days of the issuing of the notice of decision. Only specified persons, public bodies, registered owners of land to which the plan may apply, the requester to amend the plan, and the minister may appeal the decision of the town to the Ontario Land Tribunal. Excluding the minister, any party wishing to make an appeal must have made written or oral submissions to the council at a public meeting. Please note that third parties, anyone who is not a specified person or public body, do not have the right to appeal the decision for a zone change amendment to the Ontario Land Tribunal. So I certainly want to thank everybody who came out tonight and had their say. That's what it's about, to provide the best opportunity we can to have the best input so we can make the best decision possible. So with that, I will ask that Councillor Hudson, you have a motion to receive the reporter's information.
I do, and I just want to reiterate that this is a motion to receive. It's not to pass anything. Moved by myself, seconded by Councillor Hughes, that Council of the Corporation of the Town of Ingersoll receive report number CP 2025-271 as information.
Thank you. Discussion. Again, if anybody has any further questions or comments, make sure you contact our staff here. If you need help doing that, contact one of the council and we'll be able to get you in the right direction there. Further discussion? All those in favor? Opposed? That's carried. Thank you very much. Thank you. I know people have been here a while, so we can take 2 minutes and allow everybody to go out before we get ready for the next one. So. I'll just sit here if you guys don't want to. Oh, sorry, I forgot to have my mic on, so we'll do delegations and presentations. The first one's from the NBC Hockey League, so everybody.
Okay. Thanks, everybody, for being here tonight. The members of the executive for the Ingersoll Nobody Contact Hockey League are Jeff Van Niekerk, Nick Clark, and myself, John Condos. We wish to make it very clear that our grievances are with the town of Ingersoll and not the other user groups. We will present our ice allocation concerns regarding prime time ice. Ingersoll's ice allocation policy, revised in February and approved by Town Council in June, is not being followed in a number of ways, and we'll outline those. There's different headings here. Ice Allocation Committee, first of all. The ice allocation policy states that an ice allocation committee will be formed for the upcoming season with a member from each regular minor sport and adult sports group to review all ice time requests and prepare a draft master schedule. This sounds good, but it wasn't done. Our season was to start on September 5, and on August 6, we received the draft ice schedule, which was a shock to us. The town had taken away our best hour of ice from 7 to 8 p.m. and replaced it with midnight to 1 a.m. So the ice that has been allocated to us now is from 8 p.m. to 1 a.m. That's on Friday nights. Our players, referees, timekeepers who are students, and spectators all dreaded the late games which went to midnight in previous years. And it's always been a struggle to have enough players. It will only now be worse playing until 1 a.m. Residency requirements is another topic. The ice allocation policy states that Ingersoll residents will receive priority over non-residents in the allocation of facility time. Again, this sounds good, not being done. It became clear to us a year ago that Town Council was quite interested in the number of Ingersoll residents each user group had. Our 67%, which is now increased to 70% for this season, considerably exceeds the three minor sports groups, which had 56%, 54%, and 42%. And now we've been allocated ice later than ever before, until 1 a.m. New to the ice allocation policy is that it allows groups with 40% Ingersoll residents or registrants to qualify for ice time. The two adult sports groups had 79% and 67% Ingersoll residents. So the 40% was chosen to accommodate these minor sports groups. Town Council has set the bar too low at 40% since the requirement is high as 90% for some municipalities. And I believe 40% is the minimum that any of the other groups have as well. One of the minor sports groups has 42% Ingersoll residents last season, and we have just heard that another minor sports group is now also down to that 42% Ingersoll residents for this season. The next item, historical. These are all outlined in the ice allocation policy. The ice provider wishes to recognize long-term clients. Historical precedents will provide existing clients prior to 2024-25 access to historical ice. Again, sounds good, not being done. This is our 49th season. Our league started with 4 teams in 1977, expanded to 6 teams the following year, and expanded to 8 teams in 1983. We had 6:30 p.m. ice until 2001, when the town gave it to a minor sports group and moved us to 7 p.m. 2 of the minor sports groups had been renting ice before our league came into existence, but one of the minor sports groups has just started to rent ice recently. Some communities allow for grandfathered ice times where established adult groups that have rented a specific time slot for a significant period of time may continue to do so. Ingersoll has not chosen to do this. We have a healthy waiting list, and there are enough players on it to add 4 more teams. But we haven't requested more ice because we knew that there was no ice available. Unlike other organizations, our number of registrants, always 128, 16 players on 8 teams. It doesn't fluctuate from year to year, like some of these, like all of the minor sports groups. So we always need the same amount of ice, no more, no less. And we have that 5 hours. Participants in the minor sports groups are not tied to any organization, so they can pick up and leave whenever they wish. Here today, gone tomorrow. This happened recently when many players left one of the minor sports groups to play in Woodstock. They had Ingersoll ice. They had to give it back because they couldn't use it. The players were all gone. Primetime ice, so what I'm trying to convey to you there is we're a stable organization. We don't fluctuate up or down, okay? We've paid our rent for 49 years, or 48 years, and I don't think we're being treated very fairly here. Primetime ice, 4 p.m. to 11 p.m., Monday to Friday. So after school till late at night. And 7 a.m. to 11 p.m., Saturday and Sunday. So early in the morning till late at night. The ice allocation policy states that early versus later time slots will be shared as evenly as possible. Again, sounds good, not being done. One of the minor sports groups has ice as early as 7 a.m. and as late as 11 p.m. Another minor sports group has no ice earlier than 4 p.m. and no ice after 8 p.m. So no early ice, no late ice. Nice. Of the 5 user groups with primetime ice, we are the only one with non-primetime ice. And now we have 2 hours of it, from 11 p.m. to 1 a.m. One of the minor sports groups is using the primetime ice from 4 to 5 p.m. on Mondays, but no groups are using that time slot on Tuesday, Wednesday, Thursday, or Friday. Primetime ice from 10:30 to 11 p.m. on Sunday is also not being used by any of the user groups. Why should they want that ice when they can get 7 o'clock on Friday night from us? It's a pretty clear answer there. Standard hours of operation. The ice allocation policy states that the standard hours of operation are from 6:30 a.m. to midnight. Sounds good, not being done. We've been allocated ice from midnight to 1 a.m., not standard hours. What determines the number of hours allocated to each user group? I will ask that question because I have no idea. One of the minor sports groups has 39 and a half hours of ice. This group, 414 registrants, has less than half of the total registrants, which was 867, of all the user groups with primetime ice. They have 63% of the ice, primetime ice. Seems reasonable to me that this group should have less than 50% of the time, 50% of the ice. Not being done. We have about the same number of residents as one of the minor sports groups. They have 12 hours of ice, we have 5, more than double what we have. So there's some questions I would like answers to there in terms of how, is there some formula that's used to determine how many hours each is allocated to each group? I would argue that some of these groups have way more ice then they should be entitled to. We have the same, oh, sorry, I've done that. Ages in the ice allocation policy are addressed as well. The age for adult sports groups remains at over 19 in the ice allocation policy. But the age for minor sports groups was changed from 19 and younger to 21 and younger, clearly to accommodate the minor sports groups. It makes no sense that an adult is over 19 for us, but not for the minor sports groups. Double standard. Why is a single age, 19 or 21, not used for all groups? There should only be one age that defines an adult. So, what should it be, 19 or 21? The ice allocation policy gives minor sports groups priority over ice over adult sports groups. Are minor sports groups with teams which are not youth being given priority for ice over adult sports groups? Some of these minor sports groups have adults playing in them too. Are they going to get Ingersoll Ice and be treated as a minor sports group still? They've got adults and youth in there still. Anyways, to conclude, Ingersoll residents and Ingersoll adults deserve better consideration for ice than they are getting. Thank you very much for your attention.
Thank you, John. We had a conversation for an hour and a half last night, so to say that you didn't get answers, we got a lot of answers last night, and so I'm a little bit surprised that we have the same rhetoric happening this evening. I can tell you that we have one ice pad, and we have the equivalent of 1.5 ice pads of want. There's only so much ice, and we have more people using it. In 1977, the population of the town was 8,000 people. It's now 15,000 people and growing. We cannot, this council is sitting here trying to get a $37 million facility built, but it still won't rectify that. When you say that things are not being followed, there's a number of things that you're cherry picking from that list that you're giving there that doesn't state the whole fact of the policy. And that's disappointing because the rhetoric that's going out there is not true. The choice to go from 8 to 1 is a choice that your league made. There's multiple options to be able to use that other ice. There is other ice available, as we discussed last night. There's multiple nights that are available to ice if you wanted to expand and other groups wanted to expand. Things change over time, and my concern, and this is me speaking, is that there's only so much ice available. The town of Ingersoll rents it out. The user groups need to work together. Otherwise, the policy comes into effect, which it did. And so we have a bunch of user groups that qualify, and to make sure that people from Ingersoll can play in their own arena, that was a choice of council made to make sure that people can play here, which they couldn't before. Everybody has to give up something. I have a sheet right here. Ingersoll Minor Skating Club gave up 3 hours of ice from last year. Ingersoll District Minor Hockey gave up 30 minutes, but they also switched off to give up the Inferno an hour of that time, and they switched to play to Monday. Do I want people playing from 6 to 7? Absolutely. And I spoke to you last night. I wanted to make that change to make sure that that is primetime ice. But if your problem's with the town of Ingersoll, we need to work together to be a final resource to be able to be made. Things can't stay the same for 48 years and have resource levels when there's kids who want to play as well. This is the same policies that other towns follow. This is also the same policies that, primetime ice isn't available to adults. Other words, this is trying to work together. Staff went above and beyond to go outside the regular service hours to be able to bring staff in to be able to make sure that you got the same amount of regular hours. It's not ideal, but at the end of the day, there's only so much ice available and there's only so much resources, and there were other options presented to you, and it's up to the leagues to make sure to choose what's best for them. Go ahead.
Yeah, with regards to the Ingersoll Skating Club, those hours that they gave up, as far as I know, were done voluntarily. They didn't need the ice. So they did give up that ice, and that was a big chunk, but they didn't need it this year.
Excellent. That's what I expect from every user group if they don't need the ice to give it back.
Right. So, and I would say that some of these user groups have way more ice than they need, okay? But they don't want to give it up, okay? They might not need as much this year. If you give it up now, they might not get it back next year. So there's a lot of ice that's being wasted.
I guess one thing that I want to ask is, does the town do anything to ensure that user groups are not manipulating the amount of ice they have so that they don't use it? For instance, I have a son in minor hockey, and quite often on a Wednesday, a practice will be thrown in for another day because they don't want to lose the ice and they want to make sure. So my 7-year-old ends up on the ice 3 or 4 times a week playing minor hockey in local league just so that they don't lose the ice. So is there any, sorry, am I rambling?
No, Kyle would like to answer that question.
Okay, I will answer, but this all gets very tricky because you have to remember that at the end of the day, the town of Ingersoll just rents ice. We are not, Ingersoll Minor Hockey cannot speak for them. We are not Ingersoll Skating Club, cannot speak for them. We just rent ice. So that said, what happens is, at the ice allocation meeting, which all the user groups sit at, when we review requests that come in, because that was a question before, how do user groups get what they get? They request it. When all those requests come in, staff review those requests in accordance with the ice allocation policy, and they draft the schedule in which you got to see in preparation for the ice allocation meeting to have a discussion. We do this same process with ball, which you are familiar with. You have sat in those meetings. We do this same process when I have been in other municipalities. This is the process we go by. When there is a dispute, you have acknowledged tonight that minor sports take precedence over adult sports. That is common amongst ice allocation policies, not just in Ontario, but in Canada, that adults play at less preferable times so that you don't have the youth of the community playing at 11 and midnight. So that is why that is done. That is why all else ice allocation policies are like that. Then, if there is a dispute between 2 minor sports groups, so say that Ingersoll Minor Hockey and Ingersoll Skating Club ask for the same hour of ice, then we as staff do a report on who owned that ice before, what was their historical use of it, have they turned it back multiple times throughout the season, and we run that entire report if that was in dispute.
So we had 7 o'clock ice. So nobody asked us anything about giving.
We don't have to ask you anything when we run the data. There are minor sports teams that turn back ice and add ice throughout the season.
Right.
The schedule you see is not fixed like you think it is. So there are times in which, yes, minor sports will turn back ice in accordance with the ice allocation policy. There is also times that they will add ice in terms of the ice allocation policy. So we can run a statistic at the end of the year that says, if you have historically rented from 5 till 6 o'clock, how many times have you turned that back? How many times have people showed up and nobody was there and the ice sat empty? We can run that number if that was in dispute. But that is not in dispute here because minor sports takes precedent over adult sports. So when you cherry pick historical precedent, etc., historical precedent only mattered if you were an adult group, which you are, and another adult group requested the same ice. Then your historical precedent would matter. But when a minor sports group is against an adult sports group, the minor sports group, according to our ice allocation policy, and every ice allocation policy I've ever seen, will give precedent to the youth.
So getting back to, you've made several points there. I probably forgot half of the things I was going to say, but okay, so there's ice available from on Tuesday, Wednesday, Thursday, and Friday, 4 till 5. Okay, one of the Monday's taken by Ingersoll, one of the sports groups, but the other 4 hours aren't being used. So nobody's going to say to the group that had our 1 hour from 7 till 8 now, can't you fit in one of those hours there somewhere? Like, come on, that ice is being wasted. They don't need our ice.
What I'm gonna propose to do is commit to setting up a separate meeting to discuss this further if you like, to get all your questions answered that you have. Is that something that you would like? Between myself, the CAO,
Going to be privy to that meeting, so we're just getting pushed aside here to, like, we're here to address the council too, okay? So they're hearing what we have to say. I'd like to proceed with that, but, like, to me, there's some unfairness here, a lot of it. Like, obviously, a group like the minor sports group would rather have 7 o'clock ice on a Friday night, our hour, than take any of those other ice hours that are available.
To address his point, the problem here is we have no lever in which we can pull that I can force an organization to take something they haven't requested. There is no lever in which, like, we live in a democratic society in which we follow an ice allocation policy. I can't force anyone to do anything.
So our
You
league-
were at the ice allocation meeting in which I spoke to all user groups about the need to use the less preferable times that aren't being used because council is looking, because we are spending a significant investment on a new arena, that we essentially have one pad of ice in which we have a pad and a half requests for, and then user groups don't use the 6 o'clock, 7 o'clock, 4 o'clock, so we further constrain that one pad of ice.
Did anybody step up and say, we'd take that 4 o'clock to 5
But
o'clock
that's
Tuesday,
why I
Wednesday,
said
Thursday,
to you,
Friday?
John,
No.
I can't force someone to take something they haven't requested. How would you like me to do that?
Councillor Halleran, please.
I just,
It is all.
Okay.
I just want to say,
They know it's there, they don't want it.
Okay.
all right, with all due respect, I think this is a very crucial time in this new policy. It is new. We just went through a whole process trying to make it fairer for the community. I think you should take the offer that the mayor is offering to sit with him, because I think it's a lack of understanding how the system is working, so that you can be more informed about how to pick and choose your time maybe, because this whole policy now is set so that we can be fair in the future. We have another MERC coming up so that we can apply the same policy. I think because it's new, we're just having a disagreement on how it's come out, and I think it's only fair to Kyle for him to be able to explain to you in detail. Maybe in a meeting you were not very clear, but just to take that opportunity to sit down so that you're proactive about getting the time slots.
Yeah, everything that we've addressed here tonight is in favor of groups other than ourselves, like the minor sports groups. We're just basically second-class citizens, I guess, Okay, so you've had ice for 48 years. That's long enough. Now,
I don't think that's the intent.
Sir,
That's not the intent.
Tonight, it seems that, again, in multiple conversations, you've failed to realize, or to recognize that the case isn't as you see it, and you failed to recognize the information coming through because of the same rhetoric every time after multiple people have tried to explain this. So I am more than willing to have a meeting to do it one more time with your whole organization so everybody understands it. But I'm not going to go through the same questions again and again and again if it's not going to help provide clarity. So I will ask for a motion to receive the delegation, please.
Move by myself, Councillor Hughes, seconded by Councillor Halleran, that the Council of the Corporation of the Town of Ingersoll receive the delegation from John Condos of the NBC Hockey League as information.
Discussion. All those in favor? Opposed? Thank you very much. We'll now go to our next delegation, which is Woodstock swim team. Thank you for your patience this evening.
Great, thank you kindly. Good evening, Your Worship, Council, community members, and anyone else who I've not named appropriately. Humble apologies. Good evening, and my name is Jane MacKintosh. I'm a proud teacher at Woodstock Collegiate Institute, WCI, and I am the dedicated coach of its highly successful, thriving swim team. So typically, just a tiny bit of background, this will be very short. We would hold practice at Southside Pool in Woodstock. However, it's unavailable for the vast majority of our season this year. So beginning in November until well into the new year, owing to renovations there. So Ingersoll then obviously becomes the best option for a pool for the team to hold practices in the afternoons after school. So I'm seeking, though, a reduction in the rental fee at Victoria Park Community Center Pool for swimming practices for the WCI swim team, again, November to March. So this is really quite straightforward. Vicky, I don't know if it's Rush or Roosh or another pronunciation, I apologize, I don't know, but I trust that that name is known to all or most of you. She, through the aquatic side of things, she's quoted Ingersoll's rate at $17.32 per lane per hour. And I don't have confirmation whether or not that includes tax. I don't know. That's what I was quoted. And we were accustomed to paying $5.92 per lane per hour. So that's $5.24 plus 68 cents in tax. And that goes up little by little over the last several years. It's not been a rate that's been cast in stone. It always goes up just a little tiny bit each year. Sometimes in the middle of a season as well, it goes up after we have a contract. And that's with no discounts at Southside. So it's not a special rate, it is the rate. Ingersoll's price then represents quite a major increase to our team fees, which, I mean, roughly that's approximately 3 times more than what Southside was charging. So as an example, just in brass tacks, our last year's swim team happened to have 22 students on it. So that becomes our denominator then to decide how we're going to distribute those fees amongst them. So they ended up being required to pay a $26 team fee, and it became $31 if they needed a swim cap. Calculating a number over $17 instead of one under $6 will triple that cost, which could result in a team fee like well over $75, approaching $100, which is a far cry from around about $25. And this substantially higher cost would have to be covered by students on the team, who will also be incurring costs associated with driving from Woodstock to Ingersoll to attend practice. Now, I mean no disrespect, Ingersoll's a lovely community and it's in Ingersoll, and it can't do anything about being 20 minutes from Woodstock, but it's just a part of the whole picture for my team. And it's another expense that they're incurring, another kind of layer to this that as their coach, I need to support them dealing with. So in summary, we are happy. We're extremely grateful that Ingersoll has a pool available for our use. Let me be crystal clear about that. That's extremely important. But we are seeking a reduction in the rental rate to as close as possible to the rate that we were paying at Southside. That's it in summary.
Thank you very much. Questions from council? I have one. Have you approached Woodstock Council about providing, since they don't have a facility you can use, providing funds for to make it less?
I have not. Okay. I have not.
Another question for Kyle. What other teams? We have other teams that currently swim teams that rent the facility as well. Is that correct?
Yes, so correct. We have the Ingersoll Speed Sharks, which would pay the council-approved rate as according to rates and fees bylaw, which is what you see on the screen, and what they were quoted. We also have the Wilmot Aces swim team that comes here from Wilmot. They pay the same council-approved fee.
Okay, and that fee is already subsidized by the taxpayers of Ingersoll?
That's correct.
Okay, thank you. Questions from council, the delegation? Seeing none.
I was just going to say, you asked my question. My question was going to be, did you approach the city of Woodstock for any subsidy? And the other question I had was, what what reduction were you looking for? You wanted it reduced to the price you were paying in Woodstock, or was there another price you had in mind?
I don't have a magical amount of money in my mind. I'm simply trying to, like, honest to goodness, I'm just concerned about the kids on my team and if this presents a financial barrier, because it will be such an enormous increase compared to what they are accustomed to. So I didn't have a magical number in mind. I just am mindful of that disparity.
Councillor Halleru?
Yeah, I just wanted to comment, sometimes it's good when people just reach out and ask, but sometimes it's the way the cities work. Like, for example, our city has its expenses, right? It has its renewable things that we have to incur costs on and then try to revenue generate to cover those costs. So even in a side-by-side comparison, we're totally different. And like everybody's asked, I think it would be helpful if you approached your council so that you can get maybe some support for your students. There's usually that kind of ask that you can ask that can help you cover the cost. Because when it comes to budgeting and things that we've already done, it's hard, especially if you ask the director, he'll tell you, we have things that we just renovated, we just replaced, and then, and precedents, you do it for one team, you're gonna have to do it for everybody, so.
I appreciate that.
Unfortunately, it can tie our hands sometimes.
And I don't pretend to know the intricacies of how anybody landed at 1732, and I don't claim to know. And I appreciate this is complex. I absolutely do. I guess, I'm also not encumbered by hard work. I never have been, nor will I ever be. I have endless energy, and I will do whatever needs to be done. I'm happy to. I could just simply say to my students, well, the fee is $86 or whatever it ends up being, and well, whatever. But I feel unwell about that, and I guess I wonder, just considering these notions, I'm interested to know in greater clarity, and it needn't be at this moment. I can pick this up outside of this venue at another time that's not 9 o'clock at night, and that's fine, about how I might approach Woodstock. And honestly, my feeling out of the gate is that I'm going to be met with, you want what? You want money from us to spend in Ingersoll? What? That's my immediate gut reaction, but I hope I'm wrong about that. And I hope that they say, oh, well, yes, well, okay, and here, and so on. But it just,
You can
seems
position
a
it,
stretch.
position it, you had to find space in Ingersoll because there was none in Woodstock. And you'd like for help to cover the extra costs. That's simple.
So,
Right.
any further questions from council for the delegation? Seeing none, thank you very much.
Thank you.
And we will, Councillor Halleru, you have a motion, please?
Yes, thank you. Moved by myself, Councilor Halleru, seconded by Councilor Veckland and Bosons, that the Council of the Corporation of the Town of Ingersoll receive the delegation from Jane MacKintosh of the Woodstock Collegiate Institute requesting a fee reduction as information.
Thank you. Discussion? I truly value what the work that you're going through for your students, and I get their struggle there. I just can't support it because we do treat everybody equally, and I really think that I don't know how Woodstock's operating their pool on such they're highly subsidized. So is ours compared to arena time and everything else, but I just can't support it based off the principle. I believe we offer a fair rate, and I think that since Woodstock's not providing a service that they usually provide, that they would be the proper venue to provide some subsidy because you are incurring a true hardship from that not happening. Again, I don't know how successful they'll be, but happy to help you help that process. So, but I just can't support this at this level. We don't give a subsidy to our own residents. So, well, we do through taxation, but. Any further comments? All those in favor? Thank you.
Thank you.
Okay. Our last delegation for this evening, which I'm sorry, you're the last delegation of the current procedure bylaw, which before we changed to have delegations right at the beginning. So, but being a member of the council yourself, that you You will know that sometimes there's good things that happen from sitting there. So welcome our representative from SCORE, please. Thank you.
How do I advance it?
We don't have to say no. We don't have to say no.
There you go, Kim. Well, thank you very much, Mr. Mayor and council, and there's certain advantages to batting cleanup, they say, and we're certainly glad to leave the last impression with you this evening. My name is Ed Ketchaba. I'm the mayor of the municipality of Bayham and the deputy warden for Elgin County and the current chair for the South Central Ontario Region Economic Development Corporation. And tonight I'm joined by Kim Earls, our executive director. And this evening we wish to give you a brief overview of what's been going on with SCORE and relate how it relates to the town of Ingersoll, what's going on with Ingersoll, and how we should actually try to find ways to enhance those synergies and keep things going from within the region. For those of you who don't know what SCORE is a collaboration between the 5 counties, Norfolk, Brant, Oxford, Middlesex, and Elgin County. SCORE has been around for the last 15 years, officially. It's been around a lot longer than that, from a mayor's roundtable. SCORE has a history of collaboration. We work very well with our neighbors. We tend to take on those projects which are larger than a single municipality can take on by themselves, but we find a way to collaborate and bring on larger projects so that it has regional benefits. And I'm just going to throw something out there. You know, with the recent slowdown that's been going on in our local economies, we know that CAMI is idling down. That has regional impact. That impacts my restaurants in Port Burwell. So in like ways, if we can find projects that can benefit the region, it has ripple effects across the whole region. I'm a believer in synergies. I've been around the organization for 12 years, and they finally let me ascend to the chair. Go figure. The structure, yeah, I think you're right, Kim. We're going to cruise through a lot of these pages because...
I will say you can be assured that council has read your presentation already. So.
Well, I'm certainly glad. Then we will hit on the highlights. Of course, our priorities, shall we say, is that we tend to focus on infrastructure that requires and support economic development. We deal with human capital by working with the workforce planning boards, both within the Elgin, Oxford, Middlesex, and the Grand Erie boards. Again, this supports economic development. And our primary focus is on the agriculture and the agri-food sector. But it does have ripple effects that affects our urban areas as well. We are an action-oriented organization, which always likes to have the lag on that. We have done many projects in the past, and we have a history of taking on projects that have regional impacts. For example, the food hub that we mentioned up there, this was a project that was initiated several years ago and eventually was spun off into what is known today as Fresh Folk. And Kim can speak to that a little more detail of what it is, but essentially it's allowing institutional buyers to source fresh produce for whatever it is, the hospitals, the colleges, whatever, directly from producer hubs. I like to think of SCORE as, what did I call that? And it's a dream. Yeah, it's a dream. Dream factory. That's how I called it and characterized it when we were in Middlesex a year ago. Because SCORE allows the participants around the table, we come up with different ideas, and then from there we spin them off into workable projects that are scalable and able to go out and source funding, leverage the funding that we have, and then develop these things, spin them into projects which we don't own at the end of the day, but it has regional impacts. And we can talk way in the history about what SCORE has done, what's created, but I think I'm going to let Kim take over right now and give you a brief history on some of the projects that we have ongoing right now.
Thank you. Good evening, everyone. I'm not going to take up a lot of time because I know you've had such a long day. I just will briefly go through some of the projects and kind of tie it back into things that are important to Ingersoll. So one of the things that I heard from council tonight was about the Heart Hub and about need for administrative support for our physician recruitment and all of those things. So all of those things tie into a regional nature. So for instance, some of the projects that we've undertaken recently have been to work with post-secondary institutions across the region. In the SCORE region, we're lucky, we have 7, and to develop industry-specific programming. So some of the examples of that are the agricultural equipment operator program in Conestoga. We also have 2 agricultural business management programs that we help develop in 2 Fanshawe campuses, one in Simcoe and one at the London campus. So those are just ideas of how we can take those regional needs and support that. One of the other things is the SCT. So, whoops, sorry, can't talk and hit the button at the same time. Southwest Community Transit. And again, when I heard your concerns about accessing regional organizations such as the Heart Hub, certainly having intercommunity transit, and I saw the SCT sign out in the parking lot across the road when I parked, is something that SCORE, again, really works on and focuses on, those large regional scale projects that benefit us all. And even though they may not be in every specific community at the outset, SCORE acts as a catalyst to be able to instigate those projects so that Curtis and his team can do all the wonderful things locally that he focuses on. One of the other projects that has taken up considerable time and effort of late is the rail project. So the Cayuga Sub, which runs from Norfolk County and Cortland through the south part of Oxford County, southwest Oxford, so just a little bit south of you, and into Elgin County, was really a catalyst for getting the PowerCo SE. And certainly lots of the manufacturing that you have here in Ingersoll, having that sub as part of the wider regional rail network really opens up logistics and an opportunity for different types of BRNE in terms of attraction and growth for your businesses here in Ingersoll. A couple other things I'm just going to mention really quick is the expansion of the natural gas program. That was a SCORE initiative, and again, that was in support of our industrial base as well as our agricultural sector and residential. And that was, we probably started that around 2012, 2013, and again, advocated for the province to have those regional infrastructure pieces to look ahead to our growth where we would be someday. And with that, I'm going to turn it back over to.
As long as you can keep up with the clicker, we're fine. You failed to mention about the infrastructure on housing and how SCORE's always had a long and healthy relationship with the Rural Ontario Institute. And in fact, it was through that relationship that when they launched the program to catalog or inventory availability or available housing within the region, SCORE was the first region that was up, and they grabbed those numbers from us. Besides the project management side of SCORE, and from an economic development corporation perspective, I think it's fairly unique that SCORE engages in those, but we have a strong advocacy role. We are often, you can find us approaching ministries and dealing with ministerial delegations in both the Roma and the AMO conferences. This past AMO conference, we attended 7 different delegations on various topics, including the SCT in support of the applications for the Ontario Transit Infrastructure Fund to expand that regional transportation network to bring a more cohesive and uniform rate structure, branding, and to expand that interconnectedness, which actually moves people between our communities, allows seniors to age in home, moves students. So for those who don't have a secondary car, for example, this development that you talked about tonight is quite huge. And the concerns are that there may not be available transportation methods. Well, the SCT might provide a model and might actually help move people to work, to school, to healthcare. Including also in the political or the engagement portfolio, I'm happy to report that Kim was recently invited to participate in a meeting with Minister Fideli down in the Niagara region. And in that particular meeting, Kim was invited, they invited SCORE to participate in the Trade Impacted Communities Fund. And we will be making application to that as well. This again will enable the organization to help foster trade impacts across our region. And we know that they're unpredictable and they're not done yet. But specifically, what we want to talk to you tonight is about the impacts in Ingersoll. And Kim has hinted on some of them. We deal with some of the longer-term, larger planning and economic development projects, which allows your local staff to then focus on the business retention and expansion items, which are important to the town. We're collaboration. We work across the 5 counties. The 5 counties are important to us. And I'm going to reach back into the vault a little bit here and talk about where some of this funding and where SCORE began 15 years ago through federal funds and the $15 million Sand Plains Fund, which was then divided up between the 5 counties and distributed through your local CDFCs, and those funds are still circulating today. So that $3 million that came to Oxford, they're still revolving and going around for business development. That was a very early on success story of SCORE, one that we're very proud of. You talked about rail line preservation, and though the Cayuga subdivision does run across the south end of Oxford, but it does offer connectivity to the CP rail, which then runs up through the town of Ingersoll. So the movement of goods and services, and we know that Geo Rail is picking up business along that Cayuga subdivision, particularly when and if they ever get that battery plant built and the tertiary industry that's going on. But we know from the integrated grain processors, the ethanol plant, now known as Alco. I can't even keep up with it. They will be moving their product on that rail. So it's ethanol moving on the rail. It's the distiller's grain that's moving on that rail. We also know that they source product within a 150-kilometer radius around them. So when we talk about economic development, I'm sorry, it is regional. It's not just Ingersoll. It's not just Bayham. It's just not Elgin County. We're in this together. Move on. So when we talk about the global trade uncertainty that we have going on today, and with the, as you said, the Community Impacted Trade Fund, then SCORE will help these businesses, and we're positioned to help move or provide support to these businesses. I'm not saying that we're going to be successful on everything, but still, we can't just stand by and not engage. From a regional advocacy point of view, yes, we're at the federal and provincial governments. We have opportunity to meet with our local MPs at any time and MPPs. We've started on that campaign this summer again to go around and revisit. And again, we felt it was very important to visit our local municipal partners across Oxford County. When we talk about inclusive collaboration, well, what we're trying to suggest is it's not the diversity, equity, and inclusion. We're talking about including all of our municipal partners in with us. When we go to meet a minister, we'd be glad to have people from the town of Ingersoll join us. So next time you see us at one of these conferences, join us. We'd be glad to take you with us. We used to, in the day when we go in to see various ministers in the past, we'd have 15 or 20 of us with us. It's always nice to overwhelm a minister. And for a reputation for success, yes, SCORE is the right size. Geographically wise, we'd be about the equivalent of the GTA. Population basis, when you include the cities of London within our geographical boundaries, we're approaching 1 million people. So SCORE is recognized by the ministries as a significant player and one to be listened to, and we've got that trust by working with the ministries over the various years and on project management. So I think we have a good reputation, and I think that we're here to stay. And this is where it's getting really interesting, because Kim has done a pretty good job, and she's lined up that table there, and it quotes directly from your strategic plan, offset by what we are trying to do as well. So we line up very significantly and very well. So from a future projects perspective, we have or are partnering with our local workforce planning boards to engage in a business HR toolkit for employee turnovers. It's happening in Elgin County, it's happening here, and any support that we can come up with to help our businesses understand and help deal with that kind of turnover, I think is important. We do support the agriculture sector, and in terms of supply chain resilience projects, ongoing. And growth-related education schools, well, satellite campuses. That was a big issue that we took up with universities and colleges at AMO this last time. With the contraction of foreign students coming into the country, where do campus, or what do these community colleges tend to do? Save the body, and perhaps you lose the arm. In other words, contraction on the satellite campuses. But keeping these satellite campuses available and alive in our communities allows students to stay local, get trained, and then enter the workforce. So it's a case of cutting your nose off in spite of your face. We got to look and keep planning for the future and keep that workforce with us. So I'm about at the end of what I want to say, except I do have a message for the mayor when you're sitting around the county table. Because I know Oxford County has given notice that they would like to perhaps dissolve the relationship with us. However, we want to impress upon you that we are relevant, that for a modest ask, our fees are only $30,000 a year by 5 counties. So $150,000 a year. We take those funds, leverage, and do a lot of good things. But keep us in mind when you're sitting at the county table, Your Worship, and we're going to make the rounds to the rest of your colleagues out there as well. Anything to add, Kim? We will gladly accept any questions, and I know it's late at night.
Questions from council for the presentation. Deputy Mayor Wilson, please.
Thank you, Mayor, through you. I have a soft spot for Sand Plains because I got to see a lot of the work that it did through the CFDC, but most people just aren't as aware because, you know, you're not maybe doing that work. Could you maybe share a project that comes to mind or something that kind of you think about when Sand Plains to give people an idea of the kinds of things that funding invested in throughout the community?
Yeah, absolutely. So just really quickly, Sand Plains was a $15 million that was laid aside specifically for this region. And again, it was in 2 streams. So one was loans, grants that went to businesses at the time to diversify out of the industry and also to spark tourism and different types of business diversification. And the other was patient payback loans. And again, those went through, we partnered with the 5 CFDCs, and those dollars are still circulating through your communities now. So I had a great conversation with Al Sim over at the CFDC, and he was kind enough to come speak at our AGM in January, and he made a really great comment that the 5 Sand Plains CFDCs are able to still loan out money, and they actually use those dollars that came from SCORE initially to really insulate Oxford County businesses against COVID, and now as we're facing trade uncertainty, and that all came through SCORE, and it's still working in your communities today. So a quick example off the top of my head are some tourism activities, also the Food Hub, which is a virtual food hub, as well as that several provincial organizations were fostered. So the Ontario Hazelnut Association, the Ontario Lavender Association, the Ontario South Coast Wine and Growers Association all came out of Sand Plains. And one of the other things that came out of that that's of particular importance to Oxford and Ingersoll, I think, was the very impetus of intercommunity transit. Way back in 2010, Sand Plains funded a pilot, which eventually grew into SCT. So I could just talk and talk and talk, but I'm not going to because I know you've all been here so long.
Further questions from council. Councilor Halleru, please.
So, thank you. You mentioned there's You picked on the healthcare talk that we heard earlier and how administrators could be something score. So tell me a little bit about how you would come in if that's something you would be able to work with the municipality.
So that is something absolutely that's done at a regional level. I absolutely respect Mr. Barrett and Mr. Graves' comment to sort of stay in our lane, but I would say one of the great things that SCORE does is to put a regional weight behind our individual voices. And we are all facing the same issues with healthcare recruitment, and so there's maybe a potential for us to work with community partners. So I've also been asked to consult and sit on the Fanshawe College's strategic planning exercise that they just went through. So to maybe get them on board to help them to, are there ways that we can encourage administrative partnerships, co-ops with our communities specific in the healthcare institutions, and then further, maybe there's an opportunity for us to collectively, as a 5-county region, go to both OMAFRA and Ministry of Health to let them know how dire our situation is. And with our growing populations, again, not to step on the feet of other efforts that are being done. You know, we're already spread pretty thin. I think we do a lot with a very modest budget, but that is our role, is if there are individual municipal or county efforts that you think need some extra regional weight put behind it, SCORE's had some great success in that area.
Any further questions from council? Seeing none, thank you very much for your patience and your presentation.
Thank you so much.
Safe travels.
Thank you for your fortitude.
Councillor Van Kooten-Bosens, please.
I do have it, my apologies. Moved by myself, seconded by Deputy Mayor Wilson, that Council of the Corporation of Town of Ingersoll receive the delegation from Kimberly Earls and Ed Ketchabaugh of SCORE EDC regarding regional updates as information.
Discussion? All those in favor? Opposed? That is carried. With that, we will go back up to special staff reports. 5 minutes? Okay. 5 minutes then. So moved by Councillor Van Kooten-Bosens, Deputy Mayor Wilson, second. Discussion? All those in favor? 9:50, we're coming back. Okay, we have a couple more items to get through here this evening on our light agenda. Special staff reports. Our first one is for the clerk's department. Mr. Graves, we'll just go right to our clerk. Thank you.
Thank you so much. So this report recommends an update to the boards and committees appointment bylaw to reflect an additional application received for the newly established Ingersoll Sports Hall of Fame Committee. The recommendation before council is to appoint Dave Cousins, who is the applicant, to the committee and to amend the appointment bylaw accordingly. At this time, staff want to point out that it is our intention to undertake a thorough recruitment effort for all of council's boards and committees with the new term of council, which is quickly approaching, which may also mean a review of the terms of reference for each before the election in 2026. Happy to answer questions.
Thank you very much. Any questions from council on the report? Seeing none, we have Deputy Mayor Wilson.
Moved by myself, seconded by Councillor Bowman, that the Council of the Corporation of the Town of Ingersoll receive staff report C036-25 as information, and that Council approve the appointment of Dave Cousins to the Ingersoll Sports Hall of Fame Committee, and further that Council approve amendments to bylaw 23-5264 to reflect this change.
Thank you very much. Discussion. All those in favor? Opposed? Thank you very much. And thank you, Mr. Cousins, for wanting to serve. We'll now move on to our second special staff report, and that's our economic development. I'll turn that right over to Curtis.
So this is a report regarding a funding request from Middlesex County to support its Middlesex Connect transit service. Middlesex recently received OTIF funding, Ontario Transit Investment Fund funding, to ensure the continuity of the service. However, there's a shortfall in operating funding. This is the first time that Middlesex County has requested funding from Ingersoll, and it's seeking a response on the request by September 30th. The report outlines the request, which is just over $81,000 between 2026 and 2030. Our analysis shows that the cost per rider would range from $48.21 to just over $100 per passenger. If we look at 2030 specifically, based on current riders, it'd be about $100 per passenger. So because of this, staff are recommending that council decline the request for funding. I'm happy to answer any questions the council may have.
Thank you very much. Questions of council? Seeing none, Councillor Van Kootenbach, or sorry, Councillor Bowman, please.
Thank you, Mr. Mayor. Moved by myself, seconded by Councillor Hudson, that the Council of the Corporation of the Town of Ingersoll receive report ED-017-25 as information, and that Council direct staff to decline participation in the Middlesex County Connect OTIF cost sharing model.
Discussion. I certainly support this. I've never been a fan of the community transit, not because transit's not needed, because I don't believe it's a viable model to get people where they need to go in a viable manner that's affordable. TIGO is a certainly situation. It's a struggle when you have a rural population of trying to get somewhere and where they need to go efficiently. It's a struggle if you try to use the service to try to get anywhere you need to go and then make it back home in the same evening. I was minded to do that. So I'd be more supportive of a different model which people could get to that is probably more economically feasible, but I certainly agree with not participating at this time. Further discussion? All those in favor? Opposed? That is carried. Okay, that takes us down to correspondence and resolution. Deputy Mayor Wilson, please.
Moved by myself, seconded by Councillor Bowman, that Council of the Corporation of the Town of Ingersoll receive the correspondence from the Diversity, Equity and Inclusion Committee as information, and that Council direct staff to support the committee's request for promotion of a self-guided walk in the Town of Ingersoll on September 30th, the National Day for Truth and Reconciliation.
Discussion. Councillor Hughes, please.
Where can I find more information about what this will be?
So if I can give a little bit of background, ISAN itself is no longer functioning. So they were the organizers of the Truth and Reconciliation Walk. That being said, the committee really wanted just something that people could participate in still. if they wanted to on September 30th to try to keep that going. So that's what really this is about, is asking that we just promote a walk, yeah, like somebody could go on by themselves, a route that if people wanted to participate with them and the others, that they could do that, but it wouldn't be a formal event like it was before, organized by an Indigenous organization. And really, it's one of those things where if something were to happen, I don't think it'd be proper for a government to organize a formal one. It would have to be Indigenous-led to have that value to it. So this is just something so people can say that if they do want to participate, this is not going to happen. This is basically the route from last year, and if like-minded people want to show up at the same time, that's great. And just support it, but they advertise that by the town. Any further discussion? Councillor Van Kouten-Bosens.
I just want to say thank you to the diversity the DEI committee. DEI committee for, it's getting late, DEI committee for bringing it forward in a motion to council. So thank you.
Further discussion? All those in favor? Opposed? That is carried. Councillor Bowman, I believe you have an alternate motion.
Yes, I do. Thank you, Mr. Mayor. Moved by myself, Councillor Bowman, that the Council of the Corporation of the Town of Ingersoll defer the September 8th closed session meeting.
Thank you very much. You had a seconder for that?
I don't have a seconder.
Councillor Hudson has agreed to second that. Thank you very much. Discussion. I certainly agree. It's getting late. And we need some clear heads to think about what's on the agenda. And we'll certainly been told that we will have HR staff at next meeting anyway, so they'll be in person. So, all those in favor? Opposed? That's carried. Okay, and we will now go into bylaws. Just wanted to suggest with the clerk, there's nothing from the closed session that's in the bylaws? No, so they're not affected. Okay, so if we could have Councillor Halleru to go into the committee of the whole to introduce bylaws, please.
Yes, thank you. So moved by myself, seconded by Councillor Van Kouten-Bosens, that the mover have leave to introduce and go into committee of the whole on the following bylaws. Bylaw 25-5411 to amend Bylaw 235264 to appoint members to the Sports Hall of Fame Committee. Bylaw 255412, amend Bylaw 013989, providing for the regulation, restriction, and prohibition of the keeping and running of dogs in the town of Ingersoll. And Bylaw 255413, Town of Ingersoll Procedure Bylaw, and Bylaw 255414, September Confirmatory Bylaw. Council and Committee of the Whole, Mayor Petrie in the chair. On motion, the bylaws are accepted as circulated.
Thank you very much. Discussion. All those in favor? Opposed? That is carried. We're now in the committee of the whole. Would anybody like to discuss the bylaws? The only thing I'll say is this is the last meeting under the current procedure bylaw. So we'll have some research to do and we'll take it slow at the next meeting to make sure that we're going on to the next one. But it'll be a change next meeting, so be prepared for that. So if there's anything else under this, because there will not be a committee of the whole to do this. Nope, okay. Councillor Van Kouten-Bosens, rise to the committee of the whole, please.
Thank you. Moved by myself, seconded by Deputy Mayor Wilson, that the committee now do rise out of committee of the whole.
Discussion. All those in favor? Opposed? That's carried. And Deputy Mayor Wilson, third reading, please.
Moved by myself, seconded by Councillor Bowman, that bylaws 25-5411 through 25-5414 now be read a third time, approved, signed, and sealed, and that this constitutes the third reading of the bylaw.
All in favor? Opposed? That's carried. And Councillor Bowman, adjournment, please.
Thank you, Mr. Mayor. Moved by myself, seconded by Councillor Hudson, the Council of the Corporation of the Town of Ingersoll adjourn the September 8, 2025 regular meeting of council at 10:00 p.m.
Thank you. Discussion? All those in favor? Opposed? Thank you very much. You never know what a light agenda looks like.
Are we off camera now?